Let's Talk. Tonight we're going to be discussing Fauci lied about ivermectin and other early remedies. Why did he do it? I invite professionals to come up, researchers, scientists, even some of the fake doctors on Twitter, researchers, and the likes. If I'm wrong about this, let me know. I just want to know why these early treatments were available. Clearly they were. And they had results around the world. I think ivermectin had been around 65 years. So you guys come, give me your opinion. Tell me why this is what it is. Seems to me like that there was a bunch of treatments that were readily available, easily manufacturable, had proven results for years, and was working successfully around the world to prevent severe COVID, particularly in early stages. My name is Grant Cardone. I am not a scientist. I am a curious civilian that was never vaccinated because it never made sense to me. So let me set the room up to invite some of you guys up to speak. If you have something to say, raise your hand. If you don't have anything to say, I'll bring you up. And I don't want this to be an echo chamber. Certainly willing to be wrong on this. But it just appears to me that Fauci and Bill Gates collectively lied to a lot of people.
I don't know how they're not dead yet.
What do you mean?
Someone should have killed Fauci already. He killed millions of people.
Why do you say that, my friend?
I don't know. Someone just needs to sacrifice one for the team just to end him.
Wow, that's hardcore right there.
My whole family hates him. We hate Fauci.
Why is that?
All the lies he's done, and I don't know. He's just crooked. He's a crooked human.
Did you read the Real Fauci by Bob Kennedy?
No. I just know I hate him. If I saw the dude, I'd punch him in the face.
Yeah. Okay.
Hey, Grant, if we think kind of deeply about this, Fauci was the perfect setup guy for this. I mean, I think you might agree that if you've served under so many presidents, regardless of Democrat or Republican, and then you finally have gained the trust of these presidencies and these cabinets, and something like this goes down and you've made a deal with the devil, the government and the pharmaceutical company know that you can get something and make billions of dollars. It doesn't matter if you just kill millions of people because the people are just numbers. They've still got their tax money coming in. So even if you sacrifice a small percentage or portion, and look where it goes. Look to obese. Look for comorbidities. Look for the way it affected the people who weren't taking care of themselves. It affected them much larger than healthy people. And so if you go after a vaccination and you say you're at risk and something happens, well, guess what? They can say it was 15 different things, but they can't really, pinpoint it to that one thing. So I think that this was a total setup for all the fun doctors that we know of, you and I do, as well as the real doctors. I'm noticing more of the real doctors are saying, yeah, ivermectin was working. And the fake doctors were saying, no way, it was ineffective and go to the vax. And those were the ones who I believe somehow have an incentive to say it was more vax than ivermectin. And so I don't know how that plays out, but I think Fauci's the fall guy because he knows he's never going to be held accountable. He's got immunity. He's got protection. Doesn't matter what he does. He got away with it, and that's the case. So I don't know. I think it was a setup, and I think this was all planned.
Yeah, it seems like there's just tremendous volumes of validation that at least ivermectin worked in early treatments. And then they came out and started calling it the worm pill. I know Joe Rogan did some stuff on it saying, wait a minute, why are they calling it a worm pill? It's been around for years. I think India had been using it. There's at least 3 or 4 countries that dropped it from their protocols. And as soon as they did, their COVID deaths skyrocketed. Like it was like in 3 weeks, they reversed it. I forget what city. It might have been Finland. Anyway, I just heard this data today. It's some stuff I was researching. So love to invite everybody up that has an opinion on this. If you're a doctor or research person, you're an expert in the field, please let us know what the truth is on this.
Last thing I'll say about this, I really lost it. And I lost all credibility and faith in our government and Fauci when he said, you know what, we should actually jab perfectly healthy children. And that's where I can't understand or see anywhere where that makes sense when they've already survived it for 3 years, even if they've gotten it. We've all been exposed to it. Now, we might not have contracted it, but we've been exposed to it. And we're now in less lethal subvariants. So it makes no sense to me that you're going to get a vax for something 2 years ago that was deadly or, quote, as deadly as something else, which was very low. But now it's not even as deadly, and there's a new variant, and it's not protecting you against it.
Yeah,
makes no sense to me.
Storm, I was reading today that ivermectin taken in the first days of a COVID, and now people are actually using it as a preventative, but the success rate was like 86%. Yet we were all told it was terrible. And I think the hydroxychloroquine was also a similar result. Barbara, do you know anything about that?
I didn't read that, but I did recently read it that just taking increased amounts of vitamin D helps the immune system. And none of that was ever addressed by Fauci or any other public figure. And, all of this is very disappointing, devastating. There was a YouTube 21-year-old, or was it 18-year-old YouTube star that died suddenly, reported in the last 24 hours. This is devastating.
If you're watching Pebble Beach right now, there was a caddy that collapsed and died suddenly yesterday, and they're not even talking about it.
What Pebble Beach tournament?
PGA tour. I'm watching it right now.
Wow.
As a matter of fact, that's going on. Yeah, and so they said when they found him, his color wasn't good, and they knew he was gone. But it was a died suddenly type thing. They had no idea. Cardiac arrest. There you go.
Wow.
But what's interesting, I find they just keep going with the boosters and the marketing and the advertising and the fear strategies. It's a relentless machine. My girlfriend's daughter just was in a ballet competition, and they were like, your daughter has to show her vaccine card. And she's like, no, she doesn't have one, number one. Number two, what does it matter anymore?
Man, you got a girlfriend, Bab?
My friend, she is a girl.
You got a girlfriend?
I know that wasn't going to land well.
Let's talk about it.
Ain't no shame in that game, but no, Dan's all man. Dan is all man. How's Singapore?
Man.
Where are you? Where are you in the world?
Man, I'm live in Singapore, man. Live in Singapore. But we got a very important conversation. I see Jonathan Bang has stepped in the building.
Oh, do I go?
And,
do I take a dive?
As usual.
Am I going?
Jonathan
Absolutely
Biden.
not, man. Absolutely not. That goddamn pro-vaccine. Jonathan, right? Look up top of that title. What is your answer to that question?
I'm not qualified to answer that question, because.
Answer the goddamn question, man. Come on.
Hold on 1 second. I know it's not the recommended treatment. I understand it's not the recommended treatment, and from what I understand, I was told they said does not work is what I've been told. Hydrochloroquine does not work, and I think a lot of people and ivermectin. I think a lot of people have died trying to use it.
A lot of people have died trying to use it. You got to make that make sense to me, my brother. Where's your proof? Where your facts?
That's garbage. My family doctor recommended hydroxychloroquine. Hello, everyone. I used to direct political talk shows for 5 years for William Wagner and Comcast Channel 25 in Santa Barbara. Hi, Uncle G. Much respect.
Damn.
I need to share all this intel with you guys.
Let's go, man.
I survived a vaccine injury when I was a newborn child. They pumped me with the MMR and way too many jabs in one sitting. The doctor said he wanted to save time. When you're supposed to go back every couple months to the next one, they jabbed me 10 times in one sitting. That's the kind of medical malpractice that's been going on. Now, let me tell you, as I got older, I got a degree in communication, did a little bit of real estate background, Keller Williams. I own property now by Lake Powell. I'm a small business owner. Hallelujah. believe in God, believe in Jesus Christ. Let's not get too spiritual, but let me just get back to the point. Directing political talk shows for 5 years. The host and producer of the show is William Wagoner. That's Wagener. He has an endorsement by Ted Gunderson, former special agent of the FBI. That opens the television show. If you watch the clips on YouTube, the TV show again is called On Second Thought. I was required to read a couple of books for research. We had to read a book called Emerging Viruses by Dr. Leonard Horowitz. That's a doctor. In his very first chapter, this book is over, I think, 20 years old now, and that was covering the HIV Ebola outbreak. I'm not making this up. This is Dr. Leonard Horowitz's testimony. In his book, you can get the free PDF online. DM me. I'll try to send you a copy of the PDF later. He claims with evidence and citations that Dr. Fauci had a hand in creating HIV. And what they did was they basically told a bunch of medical students on their internship, you're going to go to Northern Africa and save lives by injecting all these people with this vaccine. And what happened next? HIV and AIDS broke out all over Africa. Do you remember the official news story? It was some dude had sex with a monkey. Now it's some dude ate bat soup in a China wet market. They always blame it on some dude to take the attention off of Fauci and Bill Gates. Can I get a hallelujah? Can I get an amen?
Fuck no. Hell no. Hell no.
I'll give you a hallelujah and an amen.
Yeah, I mean, this guy, I blocked this guy. Jonathan, I had to block you, man. You're controlled opposition for the establishment. But, I mean, it's simple. Or you're brainwashed.
Sorry,
Go ahead, AJ. Go ahead, man. I like you, man. I like this guy.
I really appreciate you guys. I have to speak the truth, and I'm not going to, speak out of turn or take too much time here, but you're welcome to DM me. Murder by Injection by Eustace Mullins actually breaks down the numerous ways that the American Medical Association and the powers that be in the medical establishment are literally poisoning the public of the United States of America. This is Murder by Injection, nonfiction by Eustace Mullins. I'll post about it later on my Twitter wall, and I read excerpts from this on my Instagram because I know not everybody can afford a book in this economy, but this is worth a $25 book. And he testifies that, believe this is unbelievable. The American Medical Association was started by a fraudster named G.H. Simmons, who was pretending to be a gynecologist, because back then the vetting process to become a doctor was not as stringent as it is these days. So he was literally going around pretending to be a doctor so he could touch vaginas without a license. That's G.H. Simmons. So if the fish rots from the head, look at where our medical establishment is now. I mean, you go to the hospital sick, it's $25 for just one aspirin. You think they care about your health? So I could keep going on, but I want other people to be able to share their turn. And Grant, maybe we'll talk a real estate deal. I got 10 empty lots out here by Lake Powell. Come visit anytime. Your stay at Liberty Vacation Rental is free. LibertyVacationRental.com. Thank you.
Man, see the way he pitches his business, man. That's my guy, man. I like this guy.
Coming in hot.
I got a question for you. Right? Why did you block my brother Jonathan?
I'm going to go ahead and unblock him right now, but I've had to deal with so much nonsense, with people just calling me names and being rude to me. I'm trying to block out disinformation because now we are in the age of deception. We've left the age of information a long time ago, and there's so many people just reaching for whatever info they want and calling it truth. I mean, kids think they can have 5 or 6 genders now. I mean, come on, really? You think taking away guns from law-abiding citizens is going to stop school shootings? Like, people are just making up whatever truth they want. And so I'm blocking out nonsense. But I'm willing, Jonathan, I'm going to unblock you because it was kind of rude to do that. And I do want people to wake up. And I can't expect people to listen to my side of the story if I'm going to block them. So to be fair, I'm going to do that right now. Thank you very much.
That's good. Jonathan, what do you have to say about that? What do you have to say about all he said? Let's talk about it.
Well, Nelson, I don't have much to say about that. I'm at the point right now. I want to listen and learn. So give me a moment. I just got in here. I want to hear what people are saying. I just don't believe it works. So I want to hear. So
much respect. My family doctor, I went on a ski trip with him because he's helped out in my family a lot, and he had hydroxychloroquine with him in his suitcase, and he gave me one. He was taking one just before he went skiing.
100%. Once again, guys, welcome to the room. Welcome to the space. Make sure you're retweeting the space. If you're in here right now, bottom right corner, retweet the space to your hallway. And, I see my brother B. Bizzle, Brian Benstock in the building. Let's talk about it.
Nelson, I just heard what Jonathan said, and categorically it's false, right? He said, I want to hear what people say. I want, listen, and it's nonsense. We've been talking about hydroxychloroquine. I was given hydroxychloroquine by a French doctor in March of 2020 when I was sick. It took him 2 days to ship it over to me, so I had 3 or 4 days without it. And by taking the second dosage, it immediately had an impact on me. And, it was crazy. My wife got COVID 2 weeks later or 3 weeks later from me, and the governor was banning. Police reported ahead. The governor was banning a doctor from prescribing that medication for people in New York State. Governor Cuomo prevented it. And the guy in France had claimed to treat over 700 patients without losing a patient with hydroxychloroquine. And I looked to them because they were experiencing what we were going through in the States, but a couple of months ahead of us. I heard the doctors are supposed to do no harm. And so if a medical doctor prescribes hydroxychloroquine and it could work and it might work, then what would be the purpose of stopping it? And the only thing I could come up with, it was a 56-cent cure or a 56-cent remedy. And that's not what was on the government's agenda.
Well, they already had the vaccines ready to go, locked and loaded. They had merchandise they had to get off the shelves.
They destroyed tens of millions of ivermectin. I think 60 million pieces of ivermectin were destroyed, claiming that they had some kind of violation in order to get rid of them. This was literally before COVID this is 2019, before COVID was even a thing. Like, I'm starting to do some research on this. I probably waited too long, but I'm starting to dig in. I'm getting ready to do another interview with Bobby Kennedy, and I'm like, okay, I got to see what because Bobby's done years of research on this. And when you look into, like, if you go back and read the book Fauci, what is it, The Real Tony Fauci? Jonathan, I don't know if you would read that book or listen to it, but the amount of evidence is staggering.
And Grant, to go back to the evidence about him being thick as thieves with the Chinese government in gain-of-function research. He not only did he take part in producing COVID, then he sold us and profited from selling the United States government and our people the cure.
100%. And what if they would have taken all that money that they spent on marketing the vaccine and talked about preventive care and preventive maintenance? I mean, think about it. It just makes it so obvious. Jonathan, I'd love to hear your take on that. I mean, they didn't talk anything about diet, exercise, like Barbara said, vitamin D, turmeric, whatever else could have possibly helped.
Jonathan, what do you think? What are your thoughts?
Nelson, once again, but let me just say this right here, Nelson.
Man, are you camping out on the stage, bro?
No, I'm not camping. If I'm camping out on the stage.
I've never heard you be so silent.
I get
before.
worried too. Do you get worried?
No, I'm not.
God,
Nelson,
100%.
Let me just say this.
I'm like, God damn.
We lost him.
No, what it is Nelson, what it is, because we're talking about ivermectin, see, and we're talking about hydrochloroquine, which I don't believe works, okay? But let me just say this right here. And everything I heard said it doesn't work. But I've been hearing a lot of professionals on this stage, see, unlike you guys, say, come up here. And I've been doing new research, trying to get more information on it. See, I'm not just someone that comes up here. You guys sit up here and you guys don't change your mind about nothing. I still believe it doesn't work, but I've been trying to do the research.
What made you think the vaccine worked?
Okay.
What made you think that?
I know the vaccine works. Okay, but once again, Brian, hold on, Brian. But see, once again, even right now, when I say I'm getting more research, instead of being like you guys and say, "Oh, it doesn't work," that's nonsense. I'm saying, okay, I'm now trying to gather more research from other resources, okay, to see if I can collaborate some of the craziness I've been hearing. You guys are still saying, oh. See, that's unlike what you guys are saying. It doesn't work. So now I'm sitting here saying, okay, I'm listening. I want to hear, because right now, if you force my hand, I'm gonna say the shit doesn't work. Okay, that's what I'm saying.
John, you took the vaccine.
Jonathan, would you be willing to take the
Can
scientific research done?
I'm going to speak.
would you be willing, Jonathan, to take the scientific research done by a Democrat, a well-known? I mean, the Kennedy name goes back 80 years. Bobby Kennedy has known Tony Fauci his whole life. I mean, Fauci's been with 5 presidential campaigns and served 5 presidents. Like, Bobby Kennedy's known him his whole life. He's seen the entire career of this guy. And him and his family were once friends. And he's coming out saying, hey, I've done the research. Or do you think
I've got
Bobby's just a
$10,000
quack?
for you, Jonathan.
Yeah,
Jonathan, if we need to take a bet
Grant,
real
it has
quick.
nothing to do with, one second. Grant, it has nothing to do with Democrat or Republican. It has something to do with science, okay? And that's where I'm speaking to science. And be honest with you, Bobby Kennedy is a quack. To me, he is, at least. But once again, I'm open to anything, Grant. And that's the difference between, with
If you're
me
open to
and
anything, I got
I want the truth.
$10,000 for you. Here's a challenge. You put your money.
Hey, bro, you got to mute out. Let's do it one at a time.
Let's don't turn it into a casino, guys. We're just having a conversation here. I would love for us as a group of people get down to the truth. I don't think Jonathan's against the truth. I think he's coming around, actually. So, and I don't find Jonathan to be a closed-minded person. I know he's not an operative of the government. I mean, he's just not. I know that he's not. So
no, Grant, it's fun to be the controlled opposition. He puts himself in that position, and it's all good. Do you mind if I read you something from the HHS? It's 2 lines. They say, if you don't mind, they say in the rules for an EUA, the emergency use authorization, HHS, Health and Human Services, and the FDA, they say, so this is regardless of your opinion on ivermectin, hydroxychloroquine, whatever, they say, this is in the rules for the EUA. It says that they have the option to accept or refuse the EUA product and any consequences of refusing administration of the product. And this is the rule that matters, there can be no available alternative to the product and the risks and benefits of available alternatives. That's the reason. Everybody's wondering why not?
Wait. Read it again. They're talking about what right now?
So they could not.
Who's they?
They meaning HHS and the FDA. They could not get.
Okay, and what time? What time are we at right now when they write this?
This was the EUA rules that were written far before the vaccine was even discussed. Okay. These are the rules for the emergency use authorization of any medication or vaccine or anything. It didn't matter what anybody felt about ivermectin or hydroxychloroquine. What matters is they had to abide by the fact that to get an EUA on any of the medications, there could not be any alternatives that were here.
You're saying an emergency rush to a solution cannot be, it's against the law then to provide that if there's other alternatives.
Exactly correct.
Oh, now is that a U.S. law? It's
HHS and the FDA. Easily found.
Uh-huh.
I sent you a page.
So read that to me again. So read the law
the
again.
page.
Okay, that's great, but I can't hit the DMs right now. So the law is...
It's in section 564E1A2. And it says, the FDA has authorized emergency use of the product, of the significant known and potential benefit and risks associated with the emergency use of the product, and of the extent to which such benefits risks are unknown. That they have the option to accept or refuse the EUA product, and of any consequences of refusing administration of the product, and of any available alternatives to the product, and of the risks and benefit of available alternatives. There could not be any available alternatives if they were to get the EUA for other items, like the vaccine, like Paxlovid, like remdesivir, that sort of thing.
Yeah, so why not just roll out the solutions that were readily available? They had plenty of inventories of both of these solutions.
Well, I mean,
Grant?
Those that
Grant?
Those that believe.
Let's go.
Just a minute. Those that believe in, the opportunistic aspects of this would answer your question by saying, Well, if they rolled out ivermectin or hydroxychloroquine and that was deemed an
Is it me
alternative
or is
to
this thing
anything
glitching?
like a vaccine, then they wouldn't have been able to distribute a vaccine or remdesivir or any of the other things because there would.
I think we lost
No,
that
there
guy.
were
Yeah,
other
I think
alternatives.
I think we
There were other alternatives. If they have other alternatives, they
other
can't roll out.
alternatives.
They can't roll out the EUAs for the other things. So anyway, thanks for having me up,
Right.
guys.
I want to challenge that because what you're talking about are therapeutics. All right, the vaccine was supposed to be a prophylactic. All right, so there really wasn't any other alternative, so that wouldn't have prevented it from being rolled out because you're talking about therapeutics versus prophylactics, and that's something totally different.
All right, so do me a favor, DM me your source, and I'll take a look at it. I'm happy to.
What, bro? Let's not play that because here's the source. Okay, vaccines
I just
are
read you the rule
prophylactic
for emergency use
bro,
authorization. The
yeah, for
EUA
emergency
covers
use.
the vaccine and therapeutics. I don't even know.
Okay,
You know that the
but
vaccines were EUA designated. They got an emergency use
okay,
authorization. So
okay,
send me
okay.
what you're reading, and I'm happy to
Bro,
look at it.
once again, let me finish. Okay, and that's how I can tell I struck a nerve there because you got real defensive. You guys show your hands so easily, man. Now the EUA, yeah, there you go. You're gonna help them out now. So here
All
it
right,
is.
fine. I won't help him out. Fine.
So here it is. Here it is. We're talking about prophylactics versus a therapeutic. All right, and there's an emergency authorization used for prophylactic. Okay, which was not there. All right, and there are no and therapeutics. The therapeutic. You're saying that ivermectin and hydroxychloroquine would have been a therapeutic, but still, they still needed a prophylactic to prevent this stuff from spreading, and that's the problem, my friend. But anyway, I'm
Wait a
going to
second.
go
Did
and
you
get
just
some
say the
research.
vaccine was to prevent from spreading?
Yeah, I mean,
No,
I don't even know what you.
no,
I don't
no.
even know what you said.
That's
Can
I
I?
don't know
Can
what you
I?
said.
but wait, hey
one
Tira,
second.
before we see Michelle or Elizabeth were trying to jump in here and they were getting talked over.
Yeah,
So
I know
But
that. But hold on,
let
but
Jonathan finish. Let
we
Jonathan
got
finish.
exactly. We got to finish this up. You guys,
And then when Jonathan's done, I want to get a community thing to happen. So just give me a
yeah.
transition.
Because you guys are talking crazy. Because
hey,
once
you just
again,
said the
I would actually.
vaccine prevented transmission. Who's talking
And
crazy?
that's what. No, that's what it was. That's what a prophylactic's for.
To
Once
prevent
again, just like
transmission?
But it didn't, bro. It didn't, bro. It would be like giving condoms to every teenager in America and say, "Go fuck everything." You're not going to get anybody pregnant. But in this case, the condom never worked.
The condom had
yeah.
holes all in it. It was never used. Never.
Some people suggested the condom made more people pregnant.
I like
I mean,
that.
I'm just
Including
I don't even know what to
Jonathan.
say.
Well, anyway, Tara, what were you
Well,
about to add
what I
about the
was going to.
prophylactic? Go ahead.
Can I?
and
Okay.
now they're
No.
suggesting that the semen of the vaccinated men is
Okay.
actually spreading
Can
more
I
problems,
That
just
is a truth.
respond
Go
to
ahead,
what John?
Tara.
Let me
which
just give a little
Tara
backup
will
here.
not be privy
No,
to.
I don't know anything, obviously, about the semen of vaccinated or unvaccinated people for that matter, nor do I wish to have that discussion. However, Jonathan is correct. If, in fact, the man who spoke before, sorry, I don't know your name, was correct, then Paxlovid would not have been approved. But it was approved under an EUA for treatment, right? There are two separate things. The availability of a vaccine, whatever you think of its efficacy, the availability of a vaccine does not prohibit anybody from getting an EUA for a therapeutic. They are two different items, right? So remdesivir was approved for treatment. I don't know that it was that effective, but it was approved, as was Paxlovid and the vaccine. Okay? So if you think about this, what he's saying does not make sense. He's making that up. He's saying it, but it's not true. Thank you.
Grant, what did
All
you
right.
want to
That's why I got
do?
so
Where's the
goddamn
Grant,
defensive.
you wanted
That's
to
why I
do
got so
something.
defensive.
You want to do a community something. Wanted us to pass the mic to you.
Yeah, guys, I have a post up top. It says this room's insane. If you guys could click on that, it's up in the nest, and simply hit the retweet. There's 29 retweets. I'd like to get that to 100. And so other people can know this room's going on. I would love, it says doctors, does ivermectin and the HCQ work? If you guys
You
could
got it,
share
Uncle
that,
G.
just retweet it. It would be greatly appreciated. I'd like to get 100 of those if we could. It's a very simple thing to do. It costs no one anything, and no one gets sick. But I'd like to get down to the truth about it. And Jonathan and myself don't know enough to decide what is true and what is not. Thank you, Barbara.
Can I give my $10,000 bet to Jonathan, please,
Hey,
Uncle G?
AJ, let me move the mic around. Let me move the mic around. I appreciate
Okay, thank
because
you. All right, I'm out. Then.
thanks,
Thanks a lot. I'm out for now.
AJ,
Thanks.
because I know there's some voices trying to jump in. Michelle, you were trying to unmic there, but you got to unmute.
I just want to ask a question, and thank you for letting me go, because I know everyone gets so emotional talking about it that they just have to jump in, and I'm not bold enough to do that yet, although I have, and then I got chewed out, so that could be another reason I don't do that. But this is my proposition. This space has an incredible number of brilliant people that listen to it, who have brilliant careers with lots of money. Why don't you all pool your donations and start efficient, not emergency based, but true scientific research on both the current vaccine, ivermectin, et cetera, including cross longitudinal studies, the potential for being turned down to prescribe a med because it's already FDA approved for another illness and they barely have enough for that illness. So they don't want everyone else jumping on this drug. That was one of the excuses they gave. But hire your own researchers from, valued representatives and provide your own outcomes. I wrote President Biden and said, why aren't you following this? I want to know my patients are safe. And there was some research initially when New York got so many lethal cases and other states that even between the Middle Eastern countries and other countries, because the Middle Eastern, especially women, wore a scarf, over their face, they didn't die from it. They got it, but even that reduced the amount of inoculum that caused lethal level illness. So you got money, do your own, pay your own, hire your own. Quit bitching about it. Just do it. We need that.
Well, thank you,
All of
Michelle.
us
I
do.
completely agree. There's definitely ways that we can continue to do that. So thank you for sharing that. I absolutely appreciate it. And I do believe by opening up these spaces and having this dialogue, we're making some great strides in helping to disseminate misinformation and information and what have you. So thanks, Michelle. Let me move this around a little bit. Who else wanted to jump in there? We want to hear about doctors about ivermectin and hydrochloroquine. Does it work? Why was it suppressed? I want to hear who's got some information. Jim,
Okay,
you
you
had
can do your thing again.
Thanks, Michelle.
I'm gonna jump in if you want, or I can
Yeah,
hold
go
on.
for it.
Let's go, Ty. Let's go.
Okay. So no more fuck around and find out. We're just gonna start off right there. Go to nih.gov, type in ivermectin and cancer. You're gonna see every single article and study going on right now for using ivermectin for cancer. So I was unaware of that use of it or the possibility that nih.gov, which Fauci assigns all that money for, was doing all that research and putting so much money into it. So I was very surprised about that. I'll tell you from the beginning, I was not a believer in ivermectin until I found out that the VA hospital was using it since the beginning of COVID and nobody was publicly discussing it because the VA protocols weren't publicly being shared. So when I was seeing people that had been having to go to a different clinic, let's say, than the VA for a specialty, they were on ivermectin. And I was like, why is everybody on ivermectin? They're like, they're giving it out prophylactically for at-risk patients to be used for COVID-19. So you guys can go and try to figure that out and hire a nice lawyer and do a FOIA request or a subpoena for the protocols out of the VA. But the VA hospital from the beginning, since March, was basically giving everything, every type of IV medication you could give. Even Mass General in Boston was giving ivermectin. They were giving vitamin D by IV, hydroxychloroquine. Everybody has been using things. Just because people say in the news they don't use it, every hospital in America and in the world carry ivermectin for other disease states. So they always carry a supply of it. And, there's doctors that in the hospital will request it. And if they give enough of an argument to the pharmacy, they'll get it. It was the problem when people started suing hospitals because the patients were already intubated. It's a little bit too late. Ivermectin needs to be used in the beginning. A lot of people believe in prophylactic use. I am not a huge believer in prophylactic use based on certain variants. I've seen different data and implications of how it was used. I never used it, even on myself or even on my family, until Omicron, where we were getting migraines from COVID, and somebody had kind of discussed something to me neurologically what the virus was doing and why they thought that ivermectin would work. And it's the first time I actually tried it. And I got to tell you, it worked pretty fucking great. And I'm really surprised. I've looked through all the data, and I love all and respect all the people that shared all the data. And I don't know what it was about it that I wasn't sold on it until I actually tried it myself. And I had very severe COVID in 2020. So I was expecting probably a worse scenario just because of the way that I reacted to that experience. And within 3 days, I felt so much better. Now, my dad had a bilobe lung cancer and a resection during the pandemic. And he refused to be vaccinated because he's had the BCG vaccine and other vaccines because he was in the special forces. And I'd given him enough literature that provided that he'd be pretty much protected. But as a cancer patient and a smoker since the age of 18 years old, he's very high risk. And when he started to develop some cancer, everybody's like pushing the vaccine. And he's like, no, I'm not doing it. He's like, I'll die from the vaccine. All my friends from other countries that are former military guys that all are heavy smokers and have lung involvement because they were in the desert and Desert Storm and all that, have all these lung cancers, and they're all dying right after the vaccines, having heart attacks. So, and blood clots. He's like, I'm not doing it. He was given ivermectin in 4 fucking days. My dad, right after cancer, went through cancer, never got COVID in the hospital. He was taking it prophylactically for a little bit. Then he stopped. Then he went into the hospital. We did a small resection just to remove some of the nodules because I don't want to do chemotherapy on him. He did great. Gets COVID maybe, 4 or 5 months later, sick for 3 days. I was sick for 12 days. Him for 3 days, and he just had a lung resection. And he's like, I told you, take the ivermectin. So I was kind of surprised, and I took it, and I felt great. I didn't take it with hydroxy. I had an allergic reaction to hydroxy early in the pandemic because in March, we were giving out these things. People were, doctors, critical care, everybody was giving this, especially doctors from foreign countries. So a lot of physicians that are come from foreign countries are very comfortable with hydroxy and ivermectin because they use it in those other countries very regularly, like water. So they were giving it out in the beginning, and I really didn't understand the MOA of how it was going to work. But then when I was working with the VA, I was like, oh, shit, this is really on protocol, but just nobody's talking about it publicly. And then when it became publicized and they joked around that Joe Rogan was a horse face, that's when I knew everybody was an effing idiot because the guy won a Nobel Prize for ivermectin. And then I went to NIH.gov. So everybody's like, go look at the research on cancer, and ivermectin. And stomach cancers and lung cancers and
what wasn't that? Excuse me, but ma'am, what wasn't? Which one of those was it
hydroxychloroquine?
Yeah, was it hydroxy or was it ivermectin that was created by Merck?
Merck was ivermectin.
Yeah, and they won. Didn't they win? Like
the gentleman who developed and won a Nobel Prize for it, the original molecule, is a Japanese doctor.
Right.
And it's generic at Merck. It's like pennies on the dollar, right? So it's a very low cost drug. You can get it. People go over to Mexico and they pick it up over there over the counter. And like some countries have it like in just like a regular pharmacy. You don't even need a prescription. You just go in and buy it.
Some people have called it a miracle drug, like aspirin or Tylenol.
I don't think aspirin or Tylenol are miracle drugs, in my opinion. I think that we like we were putting everybody on baby aspirin, and now we know there's a lot of bleeding involved. So last year, I think it was the American Cardiology Association said to no longer, I can't remember the association, but they basically said to no longer use baby aspirin prophylactically like we were before because of bleeds, stomach bleeds. So I'm not, obviously I put my dad on a, baby aspirin, at a certain age. and we thought it was just fine, but it turns out it's not so great. So I'm not a huge proponent of those unless you absolutely need to use those. I think there's a lot of alternatives to that if you can.
But that's under a situation where you're using it daily, and I'm not talking about daily use.
Oh yeah,
like
yeah. No, yeah. So
the
yeah,
Ivory, you wouldn't like
yeah.
it sounds like the big negative on ivermectin was
and rickets. There's river blindness. Excuse me. There's people like honking at me. I was just driving, so I was trying to pull over, and they're trying to get me out of this area. The Japanese gentleman. Oh my gosh, what's his name? Name escapes me. Who won the Nobel Prize for developing it? He was curing river blindness, and there's so many implications. I started to do more research. When somebody said about cancer and ivermectin, I'm like, what? How does that? What is going on there? Like, how does that even work? Even with the MOAs, mechanisms of action, that other people were sharing to me, and the other possibilities, I'd never done a deep dive into it. I'd been on many grand rounds, Zoom calls. We were reviewing the data in the hospitals weekly in the COVID task force meetings regarding ivermectin. And there were some doctors that dug their heels in, and for their patients, they gave them whatever they wanted. The problem is the dosing wasn't accurate. And by the time they got to the hospital, it wasn't as effective because you really needed it during the viral replication phase. But now I'm starting to see that there was still some benefit regardless of when it was initiated, and for various other reasons, which we can go to in a later time. But really, it's something that people just needed to have at home on their shelf. So I knew a bunch of guys that owned factories in like India, and they were starting to import.
But excuse me, man. But so let's just have a conversation.
Sure.
By the time COVID had rolled out, most of the ivermectin had been removed from shelves, and much of it had been destroyed. Now it was still easily manufactured, but this is when they were trying to give it the black eye, and basically Bill Gates came out and did multiple interviews about how it didn't work. Fauci did the same thing, said it didn't work. But in reality, the test, there was multiple countries that dropped it because of some of this negativity. And when they did, their COVID cases spiked, literally in a week.
I saw that. So it was still being manufactured in India because there was a couple guys that basically stopped doing what they were doing professionally and started importing it. Because they had licensing to do so, and they were importing it, and they were selling like all these generic drugs in the U.S. and they created like an online prescription pharmacy. But like a lot of us were not aware of this, but hospitals were still getting it, so hospitals could still order it. So whatever source, if it was McKesson or ABC or which is America Source Bergen, you're still able to get those things and order them from a wholesaler standpoint. If it was requested, because all the hospitals had it on their shelves. They have to, because they have other indications why you would need it. So, and it's always been there. They've always had a small supply of ivermectin. They don't always use it because you have to obviously have somebody who's coming in from a foreign country that maybe, needs it, or it's required for maybe a, rare parasitic disease, but it's always kept on all shelves. And in the military, I don't know if you guys know this already. We've had any guys from the military on this call, but in the military, it's something that's given to you to be military ready twice a year. They give them ivermectin. And of course, if they're traveling to places where there's a high incidence of parasites or potential for river blindness, or it's used for many things actually. Now that I'm taking a deeper dive, now I was trying to remember the literature, because if I had it all in front of me and I wasn't driving, I could review it. But, Pierre Corey's like a genius with this. He testified at Congress about ivermectin and hydroxychloroquine. That's who you should get on this call. And then, Dr.
Okay, can you help us? Can you reach out to those people and see if you can bring them in here?
I'll just text them right on, and I'll
I appreciate that. I really appreciate that. While she's speaking, by the way, researchers are developing a vaccine targeting fentanyl as we speak. I don't know how many of you seen that.
Yeah, I saw that posted. I was more fascinated with the fact that Moderna just announced that they've gone through approval for a mRNA CRISPR vaccine with Vertex for cystic fibrosis. And I spent years working in cystic fibrosis, pediatric and adult, and transplant. And I've not reviewed any of the literature yet because it's been a little bit. I just found out last night, and I was like a little bit devastated. I'll be really honest with you. I'm very concerned because cystic fibrosis kids are near and dear to my heart. But in terms of the fentanyl thing, I'll look into it for you. And if I
thank you. I appreciate that. Invite your doctor friend in. That would be great.
Yeah.
And Jonathan, I just went and looked up Bobby Kennedy. You made a comment about him being a quack. The reason you think he's a quack, Jonathan, is because Google scrubbed all his work, his 50 years of work, and basically has the first 3 pages of Google search making him out to be a quack.
So I know.
You cannot find. I'm sorry, ma'am. Just one second. I'm talking to Jonathan. I don't mean to interrupt you, but Jonathan, I just want you to start looking for what you can't find, Jonathan, not just for what you can find. Tira only reads what is fed to her, but I want you to start looking for what you can't see. It's the way you find a crime is not all by the evidence there, but by the evidence that is missing from there. You guys cannot tell me that Bobby Kennedy has not made, and he's a Democrat, I vote Republican. You cannot tell me Bobby Kennedy has not contributed something over his 50 years that's positive. It's literally, I went through the first 3 pages. Every page says it's bullshit, his book's bullshit, his research is bullshit. Like, it can't all be bullshit, guys.
So I personally know him, and he's not only a brilliant man, but he's a very decent human being. He's done so much in terms of other Monsanto and with water supplies, and really, even though he's a Democrat, I forgive him, but it's true. And his wife is very pro-vaccine, and they live in a very interesting lifestyle because of that. But he's devoted his life to this, and everybody's a businessman, everybody in life, right? Nobody works for free. So a lot of times we're like, oh, he's just doing this for business. No, he's like a hardcore lawyer, and he's pretty brilliant, and he's respected both on the left and the right side of the aisle. And if you've ever spoken to him about what he's gone through with losing his family members and his feeling about the alphabet government agencies and stuff, it's very compelling.
No, he told me he lost 80% of his network. Not his net worth, 80% of his net worth to the Kennedy family. Jonathan, are you still in the room, or are you just squatting?
No, I'm Grant. I've been listening to you. As soon as you stopped talking, she jumped right on.
Yeah.
The one thing I want to say is the military. About ivermectin. The protocols for Mass General, when they were using it in some other hospital systems, are still originally online and they're archived. But I'm going to tell you, I've been in 25 hospitals just in one area alone, and everybody has it on the shelf. So it's IDNs, which are integrated networks of hospitals, so they start to buy up hospitals, and they're throughout the U.S. Their shipping usually comes like either centrally sourced, and they'll ship out drugs, or
what do you do for a living, ma'am?
I can't discuss all my stuff, unfortunately.
I know,
I wish I could.
What's your title? It says you're a closeted virologist.
Yeah, so I do a lot of.
What does that mean?
I do a lot right now. I'm working in pandemic.
When are you going to come out? When are you going to come out of the closet?
Anderson
Cooper's come out 3 times, so I don't know why you can't come out here tonight on Spaces.
Oh, I wish I could. I wish I could.
Well, give me a hint.
I can't, unfortunately.
Okay.
I can't, unfortunately, but all I can say is that I'm focusing now on Moderna, and I'm focusing on the 15 mRNAs that are coming out, and I'm focusing on the ivermectin and NIH and cancer, and so that's going to be very helpful to the world. And I'm going to look into the fentanyl thing for you as well, and I do a lot of
awesome. Thank you.
Forecasting. That's
you got called. One second. You're doing a lot of talking tonight, but you got called out pretty hard the other night. You do recall that, right? You get called out.
It doesn't seem
man,
like
Jonathan, get off her ass, man. Get off her ass, bro.
Hold on. So you guys.
So John,
hell is wrong with you?
Way I wouldn't be back on here now, would I?
Let's go.
No, so
after I got off that call, I heard a lot of people defended me. So God bless them. God bless you. God bless the guy from T-Mobile. I hope he finds a phenomenal psychiatrist. But put your money where your mouth is.
That guy needs help.
We've been trying.
I don't think psychiatry can help him. I'll tell you what I think that guy's
abuse of women. So
abusive women. There you go. You lost me. Abusive women. See, and you can't come on here. And let me just say this to anyone in the audience.
We've been trying to help him for years. So you're not alone. You're not alone on that.
One second. Hold on, Babs. Hold on, Babs. One second, Babs. 1 second.
Hold on. That guy's a perfect example of why you don't want to use meds. Okay.
What the fuck, Grant?
I'm serious, dude. I'm serious. That dude is gone, bro. I don't want to be friends with that guy. I'm done. I'm done with that dude.
Yeah, 1 second, Babs. And guys, listen to me. You guys are coming up here and you guys are making arguments,
You
okay?
lasted longer than a lot of us. Let's move the mic around. Hey, Jim, what do you you want to
Babs,
jump
you
in
can't hear me
there?
talk?
Babs. Jonathan
Yeah, we
speaking.
hear you talking, but you never have anything to say,
No,
bro.
I actually was speaking.
Oh.
What I was
Why
saying.
don't you bring some of your pro-vax people in here? Why do you always come in here by yourself?
Now they come in. You guys don't bring them up. But I tell you
Goddamn
what.
Lone Ranger.
Well, what I will say is this. I want to say something because Closet, what you did, I despise what you just did. You came in here as a professional and you argued some information. And
then
then
she wouldn't tell us what she does.
Yeah, that too. That's huge.
I don't love that.
You want to stay in the closet and hide what you're doing. But then when you said someone was arguing a point about you, you said, "Oh, I'm a lady." Your information does not have any
but
gender.
Jonathan, you're like a closet trans. So why don't you come out?
Yeah, well,
God
your information has no gender at all. And for you to do that, you lose all credibility because you say, "Oh, go easy on me and go easier on my information because
When did
I'm a
I
woman."
say that? I never
You just
said
said
the
because I'm a
lady.
woman.
I didn't say anything like that.
You just said it a little while. Okay, you know what?
No, never said it. Why don't you
Yes, you
call
did.
back the tape and
I wouldn't call
re-listen
you.
to it?
Okay, you know what?
I said that the guy
The
from
replays are
Grant,
on.
Google
is it
apparently
possible I
abused
could
women
speak
at his
for a
work.
moment? Is it possible I could speak for a moment?
Yes, please.
Shit.
Ma'am, please.
Hi, Grant. I just wanted to let you know that the closet virologist is actually spot on. She's actually correct. I'm familiar with both of those drugs. I've taken hydroxychloroquine for 4 years for rheumatoid arthritis. I treated that for my parents and all my family when they had COVID.
Where
Some
do
were
I get
vaxxed
that?
and some were not.
Where do I get that?
Some were vaxxed and some were not. I'm sorry?
No, where do I get it?
Grant, I'm
Where do you
posting
get it?
everything.
I get it from my doctor, my rheumatologist. Ivermectin I've been taking off and on since 2016, and I get that through Mexico. And that's because I looked into parasitic cleanses. Cancer is parasitic. Unfortunately, hydroxychloroquine and ivermectin are both antiparasitic medications. Ivermectin, what it does is it paralyzes the adult worms. And when adult worms are paralyzed, they do release eggs. So you do want to probably kill the eggs. Where ivermectin doesn't kill the eggs. So there are herbs and things that can kill the eggs. But those two medications are both antiparasitic medications. So unfortunately, this flu on steroids called COVID, it is damaging to the body.
But is it really a flu on steroids? Is it any worse than a flu?
I believe it is worse. I believe it's on
different.
steroids. I do. And I think that the closet virologist was spot on. I'm sorry, but she was great. She was spot on.
That's my girl. My girl.
She was absolutely spot on. I'm very impressed. And the reason I went down the rabbit hole with the parasitic cleanses is because both my children are vaccine injured. My son had a seizure right after the HPV vaccine, and my daughter is autistic. So back in 2016, I hooked up with people from Mexico who Big Pharma would probably kill today if they found out. And they help people with chlorine dioxide. They help people with antiparasitics. I mean, the whole shebang. But it's very simple. It's very cheap. And Big Pharma would be out of business if people got a hold of this information. No wonder we've been silenced.
Just
Can
one thing about
can I ask you a
ivermectin.
question? Can I just jump in and ask a question?
Yeah.
Your son got the HPV vaccine.
Yeah.
What convinced you to do that for him? And by the way, I have my son has vaccine-induced epilepsy from childhood vaccines. But I'm curious, that HPV for boys.
I know.
What made you get that?
I believed these doctors. I was naive. I was busy, single mother. I was working. I couldn't get my head above water. I didn't research anything. I believed these doctors. And that was back in probably 2014 that this all happened with him. And it took me years to realize what happened to my children.
And I think that's the big problem that we have as a society. We've completely abdicated our medical,
Literally.
freedoms to doctors, and we don't realize that they're indoctrinated into a thought that keeps us all sick. I mean, Nelson's heard me say it before, cradle to the grave. My son's on a lifetime of medicine. I can't get, I'll never be able to get him off it. So anyway, I was just curious. More people need to be educated on that.
I agree. And just simple detoxing, just get the bowels moving. Just take Metamucil and magnesium. If you don't do anything else, do that.
I think the biggest crime that I see being committed is that parents aren't informed. That we're supposed to be informed about these vaccines, why we take it, and the
Yeah.
possible adverse reactions. And we're really not. We're just being treated like sheep, abdicating responsibility, and it's not our fault. And honestly, you're in my camp, which is I learned what it means to not you can't unring a bell. But now
Yes.
I use my voice to say, listen, just do your due diligence. People call me anti-vax, and I'm like, I'm not
Yeah.
anti-vax. I'm like, I'm pro-informed consent. I'm like, you can
Yeah.
do whatever you want to your body, but
Yeah.
boys getting that HPV vaccine,
Is
I'm like,
ridiculous.
can we stop doing that?
I
They can't
agree.
get HPV. It's
I
a crime.
agree.
I mean,
The reason behind that, the doctor said, was to protect his girlfriends in the future. That this would, and that was
that's
the reason.
marketing. That was a marketing
Hmm.
ploy.
And I was too busy. I mean, working. I'm not in the medical field. I don't know, but after that, I did join the medical field, and because I wanted to see firsthand. And Western medicine is good for, emergencies and surgeries. I'll give them that. But when it comes to vaccine and diseases, I would not trust. I'd rather go to
Yeah,
Africa.
no,
And
I'm for medicine. Listen, I had
yeah,
to go through chemo for cancer, so I'm not like
okay,
anti medicine, but
yeah,
I'm pro informed consent. I would have loved to have
yeah,
not have done chemo, but I find that very,
yeah,
very fascinating. Closet virologist, I know
yeah.
you wanted to jump in there. Go
Well,
ahead.
just one thing. I'm going to post everything regarding ivermectin and colorectal cancer. I got to meet Chadwick Boseman just once, and he was one of the finest human beings. And I was devastated when he passed away. And when I saw ivermectin and colorectal cancer information, I'm going to post all the studies. I put it in the nest, but if everybody would do me just one favor, just download those studies and leave it on your desktop or print it out for your kids in the future, or maybe for family members, because at some point you're going to look back at it and you're going to forget that maybe we've discussed it. And you have to create your own libraries at home, your own medical libraries at home for your children and your grandchildren, because the information on
Yes,
these Twitter spaces we need to pass down to others, because our teenagers are not thinking, oh, I need to save studies from the NIH on ivermectin and colorectal cancer because we loved the Wakanda movie. But because what happened to Chadwick, you can talk to your teenagers and say, oh, look, there's a study. Read it at the dining room table. I make my kids do it all the time. And of course, they're adult teens now. But since they were little, I would make them read studies to me because I wanted to see how they rationalize it. And even though they're not interested in the sciences or in medicine at all, it trains your children's brains to look at things in a different way and question things. That's all I have to say. And
yeah,
then Barbara, I back channeled you regarding the seizures. There's a lot you can do with homeopathy to stop post-vaccine injury epilepsy. So I'll get you the name and references of a couple of people, and we should be able to depending if it's not as severe as it potentially other people could be. There's a lot we can do to prevent that from occurring, and to get patients sometimes, not always, off of epilepsy drugs, which is really beneficial because those also have a side effect. So
Thank you.
I'll give you some referrals, okay? And then
I appreciate that.
And then just please, I'll just keep posting. I'm going to go mute because I got family stuff to do, but I'll post the studies and please take a look at them and I'll put them in the nest. Okay. Thank you.
I have one question
yes.
for the
Thank you.
closet virologist. One question for the closet virologist before she goes, please.
Okay.
What do you do if someone is damaged by the vaccine? What do those people do? Like, you've now taken the vaccine, you've got some kind of physical damage. What do you do to, undo?
What I've heard is there's no way to remove that mRNA. There is absolutely no way. But the vaccines are also highly toxic. Parasites thrive on toxicity. You could remove the toxins. One of the best supplements would be NAC. That's N-acetyl-L-cysteine. It's an amino acid, and it's also a antioxidant. Probably the strongest one you'll find. You can get it at health food stores. NAC
So
would be your best bet.
I'm going to post in the chat. FLCC has a post-vaccine injury protocol.
They do.
There's other people that do as well. I can tell you what some rheumatologists and me have been working on protocols for vaccine-injured children from the COVID vaccine, especially ones with underlying autoimmune disorders. Like I just had a Crohn's disease case, and I, we're just kind of brainstorming and working on what to do when they've had 3 or 4 vaccines because they're Crohn's and they're a younger person, and now we're seeing other issues. I don't want to discuss too much because I invited them to this, so I feel bad to I don't want to discuss anything more than that, but there is stuff to do. So, for example, monoclonals, up until the fact that they just pulled them, because technically they're not showing viral activity against the new variant of XBB. But monoclonals people were using to help people that were vaccine injured. Sometimes it worked, sometimes it didn't. And I can post the mechanism of action of the thought process of that as well in the feed. People were using exosomes. So there's very big exosome clinics that are being used right now. I've sat down there's a big one in the West Coast and there's one in Texas. I know there's people back east. There's people like Dr. Hayter, who has the HAYDER. He also has one. You can also reach out to Dr. Urso, Dr. Ryan Cole. A lot of them, Unity Project, they're posting, where people can get care. So there's exosomes being used. There's EDT chelation. Again, this is all that, I'm peripherally looking at. I know what people are using. I know what we're discussing in working groups, because we do see a lot of vaccine injuries, and there has to be protocols, both from autoimmune, like rheumatologist, immunologist, even now critical care guys are looking into protocols. And then there's a lot of other like nutraceutical stuff that people seem to be using. And some people were using IVIG, but there's a concern with spike protein inside the IVIG, which is blood plasma. There's like a slew, like Dr. Healy also has a phenomenal protocol. And everybody there, it's all pretty much laying out the same way. Exosome is very expensive for regular people, and it's a shame that it's so expensive. But there's some very big celebrities in the news that got severely vaccine injured, and there's a big doctor in the West Coast.
What celebrities you talking about?
I don't want to say that HIPAA.
Okay, but you can't keep doing that, Closet. You can't.
Oh, but you can, Dave. I mean,
no, you can't keep doing that though.
That's said it.
Grant, yes, you can, man.
Who are they though, dude?
It's a HIPAA violation. So if you go to
why? You don't have.
But she's not their doctor. What are you talking about? She's not their doctor.
You don't have like. You're not their doctor. It's not a HIPAA violation.
So I'll give you an example. Let's say the doctor they went to knows me, and he says, "Hey, can you just review this case for me? I want other eyes on it."
Okay, but you can't do that. It's like
so, but you can.
I know.
You can go on their Instagram.
Telling you, I'm on your side.
So I will back channel you that doctor's Instagram, and you can actually invite him in one of the calls. And he's very close to Robert Kennedy Jr., and he's very good at what he does. And I'll back channel you, and then you can have him say his patient names. But
Grant, she comes on, she gives us all this information. You can't verify who she is. She tells you, "Oh, I know I know Robert Kennedy. We're real close. Oh, I know these people and these celebrities." She's saying all of this stuff under the veil of closeted. Which virologist?
I hear you. We got 4 hands up. I just want to move the mic around and make sure that we're getting everybody in here. So again, I appreciate everybody joining us.
Grant, I'll send you on the back channel the doctor's name and the page, and you'll see all the people that he's treated. NFL, there's NBA guys, they're all on there.
Okay. Thank you so much. And then just want to thank everybody for sharing the room. By the way, over 100 people did that. Thank you so much for supporting me in these rooms. Barbara, thanks for being here as a co-host. Jonathan, thank you for coming. Let's go to Success and then Jim. And please raise your hand if you want to talk. Put it in a request and I'll find you.
Thanks, guys. Thanks for all you guys do. Nelson, Grant, and Barbara, you guys are awesome. Jonathan, you're something else. You're a good dude, but you don't align with a lot of things that I see eye to eye with. But that's okay. That's what makes this country great. But what I wanted to get at, guys, is I had a question for you, Jonathan and Tara. Do you guys just answer this question, yes or no? Do you believe your government? That's all, I want to know that question, a yes or no question. Do you believe the government?
That's not a yes or no.
Who you asking?
He asked me that, but that's not a yes or no because I believe my government on some things and other things I'm not so sure about. I don't believe them all. So that how can you say that? I mean,
hold on. Here, I'll be more specific. Do you, with all the things that have transpired, let's just say in the last 6 months, do you still trust your government?
I trust my government, but that doesn't mean that my government is going to do the right thing every damn time. I tell the truth every goddamn time.
So you're saying you believe in rainbows and butterflies, is what you're saying.
I think if anyone heard my answer, they would think my answer was logical. And I think logic escapes you there because I was very logical. I trust my government, but I don't believe they're honest all the time. What do you? Wait, that's crazy. I answered
So
it.
I'm not saying. I'm just saying. You need to start thinking outside the box and not think everything the government's approved or says is fact and that it's true and that they're here to protect you. There's tons of corporations around this world that could care less, and you're just a fucking number. And it's the same thing with our government. And if you're too blinded by that, you're never going to see the light. Like, there's things that our government does that doesn't benefit you or I as a citizen, and they've been doing it for a long time. And it doesn't matter if you're on the right or left; both sides are guilty of a lot of bad shit. And what I'm getting at is money is the root of all evil, as we all know, when it comes to when you don't actually make money in a normal fashion. And what I mean by that is building a business and growing a business, not just clinging to the government that we know and milking off their money and the government's money. And that's that's the problem, Jonathan.
Okay.
You're so involved. You and Tara always come up with these supposed facts, and they're from the same exact sources that our government pulls all this bullshit out of. And what I'm getting at is you believe more in your government than you do the American people, and that's sad. American people have been hurt in this situation, and you tend to side with the government, and the government's playing you like a fool.
Okay, bro. I appreciate you coming up and
Thanks,
making.
Success.
I appreciate that observation, but I think I said something that's totally contrary to what you just said. So I just want to say that. That's all.
Let's go to Alex. It looks like Alex with a, I don't know, NFT looking dude.
Hey, thanks, Grant C. Certain, longtime fan, been a longtime listener. Thanks for having me up here, Grant C.
Oh, you got it, Alex.
Barbara
Good to have you
Nelson.
here, Alex.
I mean, one of the best hosts in the space. Like I said, longtime listener, really excited to be up here. It looks like we're talking a little bit about the FDA. Okay, well, Grant, you're in shape. You don't look a day over 70. You have kept your physique. So, talking about the FDA, are you aware of the health risks that trans fat that exists?
You got anything trans? You got to talk to Jonathan about. He's the expert on trans.
Well, funny.
Him and Tara. Him and
Good one,
Tara
Grant.
are the trans experts.
I mean, trans fat's got to be. It is actually. It's the worst fat for human health. And matter of fact,
Okay, let's go to Hiley and then Alan Paul.
100%. Uncle G, Barbara Majeski, Nelson, Jonathan Bing. Just wanted to come in and say thanks for having these spaces. Respectfully, Jonathan Bing, you don't know what the fuck you're talking about.
Fuck are you doing, man? Fuck are you doing?
I think he's trying to be you,
the fuck
Nelson.
do you think you're doing? Bro.
That was a
this
motherfucker.
But he's here every night. He supports us every night.
Hey guys, what's up? Am I up next or am I second after some lady? She hasn't come up.
Go ahead.
Okay. Well, first of all, Uncle G, I love you, man. You're amazing. You've helped me a lot. I followed you since 2014. Awesome advice. Thank you very much. I just wanted to say that I have never been a believer in the vax. Since April 2020, I have been exposing that as much as I can, putting out as much information, had my Facebook account closed down that I had since 2017. They closed it down, boom. I think it was March, just before my birthday in March 2021. And just an interesting side note is that ivermectin was originally, what I understand, was originally created for sheep, for parasites in sheep. Anyways, so I just wanted to say that. But and then the last thing I wanted to say was, regarding psychiatry, there's a website called Citizens Commission on Human Rights. I highly recommend anybody who really wants to know about psychiatry, visit that website, Citizens Commission on Human Rights.org. Okay, that's it. Thank you very much.
Okay, thank you very much, Alan. Appreciate you. Sheila, and then Jose.
Hey guys. Hey, I've been researching a lot of this over the last 3 years. I'm just a mom over here, just trying to keep our family healthy. And I first heard about ivermectin from a fellow NF dad, and he had gotten a shot of it, and he said it helped him tremendously. So then I just started researching it and following the doctors. Dr. Mary Bowden from Houston is somebody who you should highly that you should speak to about this, because she actually got fired or prohibited from going into.
Can you invite her in here?
I did. I actually messaged
Okay.
her,
Let me know
and
if she gets here, all right?
all right, and then I also messaged Dr. Molly, because Dr. Molly again was someone, and Nelson knows Dr. Molly, loves her, but she's another one that is prescribing the ivermectin. It works. I've had several of my friends who have taken ivermectin. In fact, one is she's almost 70. She was in bad shape. Her husband was vaccinated and she wasn't. And she was having a hard time breathing. Her oxygen went down. Her doctors would not prescribe. She actually contacted Dr. Molly, and Dr. Molly got her the ivermectin and the other treatments, and she got better within probably 3 days. Her doctor contacted her back, and she told her doctor what she did and that she was getting better. And mind you, she was still on oxygen, but and her doctor saw that she was getting better, but told her to stop the ivermectin. It was incredible. She never stopped it. She continued. She didn't go back to the doctor, and continued to listen to Dr. Molly. You asked where can you get the ivermectin? You can't get it from doctors that are in the network. You have to go independent. I went independent to find doctors. Dr. David Brownstein here in Michigan is a holistic doctor. Although he doesn't prescribe ivermectin, he does the high vitamin C, high vitamin A, high vitamin D treatments intravenously to help people get through COVID. And that's in the early stages of COVID when it's replicating. So, just follow those doctors. And like I said, I'm trying to get them here, but Dr. Pierre Corey, Dr. Even Dr. Dr. McCullough, but Dr. Cole, all those doctors that you see on the FLCC, these are the doctors that have been fighting. And anybody who's been silenced after talking about ivermectin, those are the people that have been trying to help everybody, but they keep getting silenced. And then one last thing, I shared it with Barb, and I think I even put it in I tweeted it. But Merck actually put out a statement that ivermectin doesn't work for COVID-19. So, I mean, again, it's being attacked on all angles. And if you remember, also, Joe Rogan used it. He used other treatments as well, but he also added that part into his protocol when he when diagnosed with COVID.
Sheila, why do you think Merck, of all people, put that out about ivermectin?
I think they just got. It all has to do with the government. It really does. Big Pharma. The government. I mean, I don't know for sure, but that's all I can do is
I can
connect
answer
those.
that.
Okay.
Wait, can I just pose one idea on that one? The thing with vaccines is vaccines are insulated from lawsuits. They're immune, pun intended, from lawsuits. Something like ivermectin could put liability back on pharmaceuticals. So why would they take the risk when they could become more vulnerable? Could that be a reason?
Does Merck have a vaccine though, Barbara?
So
yes, they have yes, right? Of course they have vaccines.
No, I'm saying, do they
know.
have a COVID vaccine?
No, but they have an antiviral, and that's the one that they produced and approved, and it's third stage on protocols from the NIH guidelines. So anybody wants to know, you can go to nih.gov and look up COVID guidelines, or you could go to idsa.gov, which is the Infectious Disease Society Association. And so molnupiravir, I need to drink something. I haven't eaten or drink all day again. That is the approved antiviral by Merck. So they had a full reason why they would not use ivermectin when it's pennies on the dollar and is generic now. And I think it's actually out of a patent. So they have their own antiviral. That's why. And
Yes.
Merck is one of the largest manufacturers of vaccines. So over.
Let's go to Danny. Danny, jump in. Barbara, are you here?
Yeah, I'm here. Yeah, sorry about that. Go ahead,
Let's go,
Danny.
Babs. Come on.
Yep. I'll take it from here. Danny and then Jose. I think we skipped over Jose, but Danny, we love hearing your New York accent. So tell us what you got.
How's everybody doing this evening?
You sound like Rocky. We're doing great. Good to see you here.
Adrian!
There we go. Well, Eagles are going to the Super Bowl, so
All right.
go
I'm
Birds.
sorry if I'm going to say anything that anyone already said. I apologize because I just hopped in the room, but this will be 30 seconds, guys. My summary is this: early detection and early treatment, to my knowledge, of any cancer or disease is the most effective way, early treatment, to cure any of these things, whether it's lung cancer, COVID, breast cancer. Early detection and early treatment are the way to cure them, and the most successful way to not die from any of these things, including COVID. So my synopsis is, ivermectin and hydroxychloroquine, if used as early treatment, extremely reduce the risks of death. And I believe the pharmaceutical companies and God knows who in cahoots with the government, possibly, I can't prove that, but if people realized on a mass scale that they could treat COVID early on, not have to go to the hospital and be okay, then there would be no need for the bioweapon, clot shot, jab, whatever you want to call it. I won't call it a vaccine because ethically it's not a vaccine, because it hasn't seen the trials. So look at the amount of money these people have made, and every other theory as to the control and everything else. And I just...
So Danny, let me ask you this. Did you get the vaccine?
Is the sky blue, Barbara? No.
So you didn't get the vaccine. Did you make any of your employees? You run a construction company, right? Did you make any of your employees comply? Where did you stand on all
No,
that?
absolutely not. I believe that freedom of choice is something that this country is built on and runs on. And if we don't have that, we don't have anything. And one last thought is that this is personal for me, because every single person that I know that went to the hospital with COVID, for treatment from COVID, that they got remdesivir and a ventilator and they died in the hospital. I don't know one person that went to the hospital that didn't die from COVID while they were in there. And I know about 10 people who died in the hospital from COVID. My father's 74. He didn't get the vaccine. He got pretty sick, the jab, and his oxygen level even went down to about 89. He still didn't go to the hospital because he feels the same way. Everyone he knows that went there died. And you can get ivermectin at my local Tractor Supply store, the paste. So
really?
Yeah, absolutely. Anybody can get it at a Tractor Supply store. The paste, you rub it on your skin.
Oh, the paste.
Yeah,
Oh,
but
the
you rub
paste.
it on your
Is
skin.
that as effective? Does anybody know? I mean,
No. You just get it. You can
okay.
go online and get a prescription for ivermectin, and then we'll find you a local pharmacy. Go to like FLCC has their sites. A bunch of the doctors have their sites. I think, what's the lady, the physician?
My Free Doctor.
Yeah, My Free
My Free
Doctor,
Doctor's
and
another
Dr.
one.
Stella has it. And it's like,
Yep.
people have permission across the U.S. to be able
Yes.
to write
And
a
I just want to
prescription.
note that to this day, I cannot step inside my local hospital that I actually helped build when I was in the union because I don't have a vaccine card. I can't go in the premises. So yeah, that's just what I want to say, guys. Thanks for letting me talk.
Thanks, Danny. Grateful you're here tonight. Jose, you've been patiently waiting. Go for it. Are you still there? Going once.
Yeah, still here. Thank you.
And Barbara, real quick, they're starting to. It looks like they're hyping up to use Omicron as another threat. That it's really
100%.
dangerous. It's coming out. You guys need to get ready. What is it? February?
Zay,
We're
do you
moving
want to
it.
talk?
Yeah.
Myself? Yeah, that's all right. Grant can speak first. That's fine.
No. We were asking you to speak.
No, you know what? Okay. Tira Grant
I don't
was
think
speaking.
you can hear me.
Oh, I'm
Tira,
sorry. I didn't hear. I can't hear him. This app again. Jesus. Sorry.
All right, Tira. If you drop down, we'll bring you back up. But yeah, Grant, it's like the machine is just so full. The engine is full throttle ahead. That machine to get the next set of boosters, the next variant that's coming out. People are still in compliance with asking for vaccination cards. So I find it terrifying. And what I think everybody in this room needs to do is actually not just share this room on Twitter, but ping this out to all other platforms, because this is really the only place where you're having this kind of information disseminated, and it's being flagged on other platforms. So we need to bring more people into Twitter Spaces so we can hear this conversation. We can have this dialogue. Listen, we don't mute anyone. We don't block anyone. We ask for open conversation. You're not going to get anything like this anywhere else.
Hey, Barb,
but we need everybody's help.
Real
Go ahead.
quickly, I just want to give people some courage, right? Like I've said this before, you have a greater chance of dying getting in your car and going to the store from a car accident than you do from getting COVID. I'm 41, not jabbed, and I've had COVID 3 times, and I'm fine. Like, so, it's survivable, guys. You don't succumb.
I think what people need more information that isn't sponsored by Pfizer, and you're getting it here in only the Twitter Spaces. So we're going to help more people by getting it out onto Facebook. Say, come in here into Twitter Spaces. We're talking about X, Y, and Z, and bring your friends in here and talk about it. Jose, you were patiently waiting, so take it away. And did we bring Tira back up?
Yeah. Okay. Oh, the title's changed again. I was going to stick to the title. I think the previous one to this was, why didn't you take the vaccine?
Yo, bro, you just talk about whatever you want to talk about, brother.
Yeah. Cheers, Grant. Well, as you know, got pretty bad here in Australia. That's where I'm from. I'm from South Australia, which is probably one of the safest places in Australia when it comes around to this virus, because we're not really overpopulated or anything like that. But I grew up in Indonesia, and the first thing I started doing once this virus started going crazy was just ringing up friends over there. Considering Indonesia, you got a lot of Chinese Indonesians, so you would have had a lot of trips from Wuhan to Indonesia. So I go on these spaces while I work, so I tend to pant a bit. But like I grew up over there as they used to call me the bule reject, which just basically translates into the rejected honky. No one wanted me in Australia, so they reckon they sent me to Indonesia. And this is because I spoke the language, very well. I learnt that at a very young age. And so, got well known over there. And I knew hundreds of people that generally would branch out to, I suppose, getting over 1,000. And not one of them was complaining about Alpha or Delta. And this is pre-vaccine. So obviously I was very skeptical about it to start off with. I was almost going to get it just so I could travel. But, eventually, started doing my own research and found out maybe it's not the best idea. It's still a little experimental. But post-vaccine, I know, was it my stepbrother's auntie? She died not long. She was actually a listed COVID death. Listed vaccine death. So, sorry, someone speaking?
Oh, Grant, I think your mic is hot. Go ahead, Jose.
Yeah. I heard about that, and that's pretty much where I pulled the pin on it, and I started telling all my family, like, really, it's not a good idea to go down this path, before we find out exactly what's going to go on long term.
Did you lose any friends or family over that kind of conversation?
I wouldn't say, suppose you'd say lost. I was always the black sheep of the family anyway. So was my father, who passed in 2005. But, like most of them just kind of started ghosting me. the worst was my mother, I suppose. Like, she was trying to tell me, you got to trust the government. You got to trust the government. I said, well,
Jose, what percentage of Australia got vaccinated?
They say that the double vax or something was 90% or something like that, but it's got down to around about, for those who are actually fully up to date. I don't know. Like, I can't tell you the exact numbers.
Yeah,
I think,
yeah. And then have you guys had any are you seeing any vaccine errors, or are you guys seeing any complications from the vaccine, and what are they?
Absolutely. Well, the mayor of my town, she got pericarditis. And, in fact, she was, because I was mandated. I used to work in compliance in local government, and obviously fired because I wouldn't take the vaccine. And come across her at one point. I was going to try and get a job in her council. And she tried to help me out, but obviously her hands were tied in certain areas. But she was diagnosed with pericarditis, and she came out in the underground news, so you only really saw videos of her on Telegram. She was a bit too scared to ruin her career by coming out a little bit too public. But there's that. I have my cousin rang me up at one point saying I'm a bloody idiot. You know, I should have listened to you because she got diagnosed with pericarditis. The problem is that they come out with these, you know, they find out they have these problems, with the exception of, the mayor. She's pretty smart, but my cousin got told, oh, you'll be fine. Like, it will pass. And, they never really get told that, you know, a heart complication generally does stay with you for your whole life. So, you know, most people might have had their slight reactions to the vaccine, but then went on to just go back to their life because at this stage they're feeling fine. And any complications they may have from here, it's quite obvious. Doctors just rub that off as something else. Like, I don't know, what the most common one lately is climate change. So, yeah, but anyway, when it comes around to, like, I suppose the current title, ivermectin, hydroxychloroquine, I got my own story in that as well. A friend of mine and I decided that we were going to try and get some ivermectin into Australia, and we did try and order some from India. Obviously, at that point, a lot of people were pushing for, you know, that, a lot of people were taking advantage of that, and we actually got a.
It looks like there's like 80,000 reported cases of side effects over there.
80,000, and I'd say that's probably a number that's underreported, as Dr. Bernard has said before.
Sorry, well, thank you. Thank you for coming up and telling us. How's the economy over there? Is your economy back to normal, or is it starting to suffer?
I think we're starting to suffer a little bit now. I think we always follow behind the US, so you're starting to reduce your interest rates, and we're still going up at the moment.
Mm-hmm.
Yeah. Anyway, cheers for letting me pop on.
Thank
have
you,
a bit of a chat.
Appreciate you being in here.
Yep. All right. Thanks, Grant. Catch you later, man.
Thank you.
All right. So who's next?
Yeah. Just go next, guys.
I got a point to make, if that's okay.
Go ahead, Dr.
Go
Kevin.
ahead. Point to make.
So, I was just thinking about how I think there's a paradigm shift going on now in our country where, and by all means, you know, I practice medicine myself, but, you know, we as Americans are learning that we need to start taking control of our own health and not just abdicating all the responsibility to our family physician. You know, I believe that everybody should start taking control of their own health and doing their own research and coming up with a plan that works for them, you know, and not just blindly trusting the experts. You know, I mean, we have doctors for a reason, but it's not like it was 100 years ago, 200 years ago, when people didn't have access to how much information we have today. You know, anybody can go on YouTube and watch Harvard classes, you know, for free. And, you know, so people have so much information available for them today that they can make their own conclusions about how they want to proceed, you know. And obviously we have the experts, we have the doctors that know us and know our symptoms, you know, that is absolutely necessary. But like, and, you know, it's not like a magic title that, okay, now that you have this title that you're so much more superior to other people. It's like, obviously there's a lot of study that goes into
Yeah,
it,
but
but
I think it's clear, and I mean, maybe you guys can, I'm not trying to be unfair to doctors, that they were overwhelmed. I don't think they knew what to do. Do you guys want to just talk about how much the doctors knew or didn't know, and how much conflicting data, if they've been using ivermectin and these other alternatives in the past, or vitamin D, or they even using zinc and vitamin D and these other solutions during flu seasons, and then COVID comes around and they're being told the country's got to shut down, 40 million people out of work. Oh my God, people are dying because of respirators. And then we got to rush respirators. And then, like, weren't the doctors overwhelmed, in all fairness?
I mean, this just goes to another point of, yes, I mean, the doctors were overwhelmed. But it's a problem in our society where we've outsourced pretty much every aspect of our lives. We outsource our groceries, our, self-protection. We have the law enforcement. It's like 100 years ago, 200 years ago, people had to do these things for themselves, and so we've become so, I hate to say complacent or lazy as a society, where everything's outsourced, where it's like, we need to start, taking care of ourselves. Like, I hope this is a wake up call to all of us that we need to, be more self-reliant and not depend so much on the institutions around us.
I think the problem is that, can you guys hear me, by the way? I
Yeah,
hope
you're
so.
good.
Yes.
I think the big problem is that we have been conditioned to trust the authorities, trust the experts. And that's how we can't learn everything. So we go to our doctors, we go to our specialists. But here's, Grant, what I find something very interesting. When I went to ask my pediatrician, I said, can I get a medical exemption for my kids? And so we know my son is vaccine injured. He has vaccine induced epilepsy. But when I asked to get the other medical exemptions for my other two kids who have no issues, nothing, they wrote that letter without even, they were like, sure, no problem. Is that what you want? I said, yes. It showed me that maybe they were also a little apprehensive to give my kids the vaccine. But here's the question that I want to put out to everyone that's here. When my son was vaccine injured as an infant, my twin brother's a lawyer, and I called him and I asked him, I said, what I don't understand is why they keep making me do more vaccines when he's already proven that he has an intolerance. There's something wrong with him. Why are they doing this to me? And he said, Barbara, they don't want to get sued, because let's say all of a sudden your son gets the measles and he didn't, the doctors told you not to get the measles. The doctors are scared of a lawsuit. So they'd rather you just take the vaccine. They're insulated there. They are not insulated if they get the disease and they were the ones that were negligent in putting it out there. So I just wonder if some of these doctors were following protocols to avoid lawsuit or liability. Is that a possibility? Does anybody want to speak to that?
But Barbara, you just said that your own doctors gave you medical exemptions that might not have been warranted.
Understood,
so clearly
Tira,
they weren't
but
scared of that.
No, Tira, that's what made that with COVID-19. I cannot get medical exemptions for any other vaccine for any of my children other than my vaccine injured child. I get no medical exemptions. But the interesting thing, the reason I brought that up, I go to mainstream doctors. I do go to alternative as well. But here in Princeton, I go to very mainstream doctors. That is where I found it so suspect. These doctors bust my chops every time I go in, because I only do I have stopped all vaccines, but that's my personal choice. They literally wrote the letter and didn't bat an eyelash, when all I do is fight with them every year about the annual flu shot and every other shot that I don't want my kids to do. I fight with them, Tira. So it's not the same situation. And I'm curious if anybody.
It's true. It's true,
Yeah.
Barbara, and it's true, Tira, that unless you guys are actually fighting for these things, you're not going to know it. When you go to your doctor, they treat you like a leper, because you're like, dude, I just don't want to do this. Oh, you're not doing the science. You're being ignorant. When we home birth our children, same thing. You're being irresponsible. You have to have a hospital involved. I'm like, no, I don't. I actually don't. And I'd rather not bring my wife to where sick people gather to bring a healthy baby into the world. Why is that? I know I'm not a doctor. Nobody needs to remind me I don't have a white coat on. I didn't study medicine. I know that. Nobody needs to tell me that. I know I'm operating only with common sense. But when we bring the kids back and they're like, look, you got to vaccinate the kids. And I'm like, we don't want to vaccinate the kids. And they treat you like something's wrong with you.
And they roll their eyes, and you get, this is your decision. It's on you. And like, you haven't done your due diligence. It's very hard. I mean, a lot of people give you pushback, but I've got three, I don't know. I'm just curious if doctors, are you afraid to go against the company line, the company narrative right now? Is that something, Dr. Molly, can you speak to that? Jim, what are your thoughts?
I can speak to that. I went against the company line. I got texts telling me from my hospital they were having, the administration was having meetings about me speaking out on social media, and that I needed to pipe down. I was later fired for going against that. And I just had a hearing this week with a professional organization for defrauding the public and spreading dangerous misinformation. So all of this is costly for time and money and effort that I could be taking care of patients. It's a total waste of time. I haven't spoken to one of my colleagues since I left the ICU a year and a half ago. So it is complete and total isolation from your former network.
Do you have to get more insurance, as a doctor because you don't follow the protocols?
No. Most of your insurance is based on where you practice. That's probably the number one variable. And then what your specialty is, so like what procedures you're performing, and then how long you've been in practice. So it doesn't have anything to do with that as long as you're not sued. So to me, it's good documentation, it's good patient relationships, and knock on wood, I've never been sued.
I have another question. Do you, because you're talking here on the ground level with other physicians and doctors, do more doctors go against you? Are they quietly in your favor? Like, I want to do a temperature read from your perspective.
So most doctors that I directly knew, a lot of them kind of gave me the high five before I got fired and told me they totally agreed with me, but they just didn't have the backbone to stand up for it. They all told me, oh, I'm not getting my next booster. They were big talkers until it came time to their job was on the line. So I think there are a lot.
That's what I'm talking about. See, I like hearing that. Thanks. Continue.
Yeah,
Sorry.
so I think probably if you look at corporate medicine, a third of them are totally bought in. They'll wear as many masks and take as many shots as you want. I think a third of them don't know, right? And it's kind of inconvenient to figure this out if you have a conscience. And I think a third of them know very well, but they're in a position they don't think they can go do their own thing. They don't know how to get out of their job. They're stuck in a location because of custody with their kids. This is some of the doctors in California, right? They're divorced and they can't move out of the state. So for varying reasons, people are in the system still, or they want to try to help the people under the table as much as possible.
Could I push back just a little bit? Is that okay?
Yeah, I hear Tira, and who was the male whose voice is that?
Dr. Kevin.
Okay, Tira, and then Dr.
Yeah,
Kevin.
I just want to push back a little bit, but not about the COVID vaccine, which for children, I think people do have, many doctors have differing views because of a risk analysis. Okay, I'm not talking about that. But in terms of regular childhood vaccines, the typical ones, MMR, DTaP, that sort of stuff, I think most doctors believe that they are extremely helpful. I truly do. I think they tell you.
Tira, let's talk about that.
I think they give you that device.
I don't think that's true. The first
completely.
vaccine, Tira, I'll go there with you. Let's talk about the very first vaccine a child gets. Do you know what that is?
Can't remember. Nope.
It's the hepatitis B. Do you know what the hepatitis B shot protects against?
Well, I guess Hep B.
Give her time to look it up.
No, I'm not going to look it up. I'm not an expert in childhood vaccines.
I'm going to completely disagree with you. And I think you need to go.
No, don't you think that they believe that measles vaccines are efficacious and are helpful because they don't want kids to get measles? More to the point, Ohio just had an outbreak of measles in generally unvaccinated.
Now, if you're going to talk about the childhood vaccinations, we're going to talk about all of them. And in their totality, these vaccines have not been tested in their totality. What I mean by that and it's how these kids are metabolizing them. Number one, it's one size fits all. So no, I don't believe that. I think they're indoctrinated and they do what they're told they're to do because they're afraid of lawsuits. Because if they really cared about the health and well-being of a newborn, not a single pediatrician can ever answer to me why it is in the best interest of a newborn to give them the hepatitis B shot at birth and then to give them a booster when they have absolutely 0% chance of contracting that disease unless the parent had already had it, and it goes from the mother to the baby. When I was at the hospital,
here's the thing with that, because if you think about it, the way that doctors, how they become a doctor, they have to go through so many years of schooling and through residency, and it's a process of just grueling schoolwork, and you're never taught to question the narrative. You're taught to just go along with everything. Like, that's how you become. You're not going to become a doctor if you're going against the grain in any way. So
because
it's not that doctors don't. They're very, pretty much 95% of them. They're all well-meaning, but they're not taught to like do what you're doing about questioning, why are we giving 80 shots to a brand new born baby that these vaccines haven't been thoroughly tested.
Dr. Kevin, and I agree with you because I think it is a lot of information, and I believe with all my heart people go into medicine because they want to help. They don't want to hurt. And I don't want to come across, I'm not anti-doctor at all. Again, I'm a stage 3 cancer survivor, and I would not be here today without some crazy surgery where they took out a foot of my large intestine and then they glued it back together with glue and duct tape. I don't know what they were doing in there, but I'm really grateful for modern advances in medicine. So I don't want to come across anti-modern medicine, but I do think we need to pump the brakes and get real, because in no way is that childhood vaccination schedule is in the best interest of children when we have epidemics of allergies, ADHD, autism, asthma. I mean, these are epidemics that we didn't have 20 years ago because our vaccination schedule has tripled since you and I grew up. It's barbaric that we take a newborn child and give them a shot to a disease they have absolutely no way, zero. No doctor can get up on this stage and tell me this is how a newborn contracts hepatitis B. You have to stick an infected needle into that child of hepatitis B. You can't contract it. I had a nurse when I delivered my daughter, and I delivered her no drugs, nothing, but I did deliver her in a hospital. And the nurse came in 24 hours later. She said, let's get started with the vaccines. I said, hell to the no. I've already been here before. I'm going to say no to the hepatitis B. She looked me dead in the eye and she said, you're going to take that risk when you go to a playground? Like, how are you going to take her to a playground? This is how really ridiculous our system is. I'm like, unless I was educated, and I was educated, unfortunately, not through education, but through circumstance. But that's what the nurse said to me. I'm like, first of all, what newborn is crawling around a playground? Second of all, what kind of playgrounds am I going to? And really, what playground has a needle that actually has live attenuated blood with hepatitis? Please stop the madness. Please, somebody, I can't even begin. So
hey,
anyway,
Barbara, but
yeah,
seriously though, look at the implied authority. If you think about it, most of us aren't doctors. We're not doing in-depth, medical school type, treatment or, education. So if you think about it, it's like when you get pulled over by a police officer, it's implied authority. They probably know the law. That's what you're thinking, right? So when you go to the doctor, you got to know what they're thinking. And just to this, I've been on the operating table 9 times in my life. 6 of them were on my knee. And I remember when my doctor, he was a sports medicine doctor, and he said, yep, you need to be in OR Tuesday. And he didn't give an option. And my mom didn't understand that when I was playing sports in high school. So what does that do? That weakens the knee every time they cut you open, and then you got to do rehab again. But this guy was known to operate 41% of the time he had the OR. And it makes me think that certain doctors, when it comes to this treatment, maybe ivermectin, those are the other third that Dr. Molly talks about. That's like, look, let's look at all of our options instead of just go with the go-to. That's going to be vaccination. And unfortunately, I think the American public is not as educated about this, and it hurts.
Yeah, you remember the tonsil when they were removing
tonsillitis.
Yeah, I don't have my tonsils. Do you guys?
Everybody got them out. Like now they don't do that.
And so why is that, though? I mean, we were told as kids, we need our tonsils out. You don't want to get tonsillitis again.
Well, one thing that we have to keep in mind is that, and it often gets lost in the whole system that we have set up because of the insurance industry and stuff, that it's still a business at the end of the day. You know, a doctor is seeing you because they're going to get paid, you know, but how are they getting paid? It's through this whole insurance industry that's set up to take the payments, and they set the prices. So it's like the doctors, you know, like traditionally, you know, 100 years ago, before insurance was even a thing, you would go to the doctor and you would pay cash or whatever, and then you could like even negotiate on the price and stuff. But it's become so corrupted through the insurance industry that they're the ones that set the prices, and they inflate the prices of everything. So that's a big part of it as to why it becomes corrupted, is because the prices are just astronomical.
Dr. Kevin, can I ask you a question? I was looking at VAERS, and they said there were roughly 668 million doses that were given, right? And I don't know if that's, you know, one shot or the fifth booster at this point. My question to you is, I tried to Google vaccination deaths for COVID, and nothing comes up. It talks about vaccinated dogs, vaccinated cats, but it doesn't talk about death when it comes to COVID vaccination. And it just makes me wonder, what are they hiding? Because
that's because
there's got to be deaths associated somehow. And they said casually, there's 9 J&J, and they say death is very rare, but they don't even list that as a side effect on the Pfizer site. So can you maybe expound upon that?
Well, the real reason behind that is because the people that are controlling the outflow of information and all of that, they're also the ones that are in control of the farm. It's like there's a few people at the top, these ultra billionaires, that they're like Bill Gates. He invested so much money into the vaccinations, right? And he, you know, you can even check this out for yourself, but he's made $500 million profit since the vaccines were rolled out. But he also has large stakes of investments in news outlets, in, you know, these fact checkers and things like that. So the great majority of the things that are being filtered, it's by like 200 people that are way at the top, and they're trying to control all the information, and they're profiting off of the medical industry, and it's corrupt.
You said you Googled it, right?
Yeah. But bro, you can't believe that Bill Gates can make a phone call to the Washington Post and say, "Hey, change your headlines." I mean, he's not calling.
No, but if you look at his donations and stuff, he's donated hundreds of millions of dollars to these different news outlets. So I'm not saying that he's the one dictating it, but the influence is there. And it's just over time that just gets more and more corrupt.
It's the same reason why you know that Google has affected the elections. It's the same thing. It's
Google has patents. Google has patents on vaccines.
Corporatocracy. They're involved in all of it.
It behooves them to be pro-vaccination because they own patents for a lot of these vaccines.
Can we just address the elephant in the room here regarding doctors? This is really the unfortunate truth, right? It's medical fascism. That's what's going on here. This is long-standing. Rockefeller set up the American Medical Association for the petroleum industry. He absolutely removed all natural medicine from the indoctrination of doctors to become doctors. That's what this is about. This is about money. This is about power. This is about control. It's about corporateocracy. Please read The Doctrine of Fascism by Benito Mussolini. I posted in the Nest. It explains the medical tyranny. They use the medical industry to impose fascism. This isn't a conspiracy theory. This isn't any nonsense. This is reality.
How does that impose fascism?
Because you trust your doctor, right? Don't you? Everyone just trusts.
They control what's going in your body.
I know, but this can't become a hate room on
It's
doctors.
Not at all. Grant, like what I'm saying is,
you can't tell me the doctors are not signing up. The doctors are signing up to do
I agree with that. But aren't they also like was previously stated? They go through this process. They spend hundreds of thousands of dollars over 8 years, let's just say, right? Between regular school, normal bachelors, and then they get their doctorate, their MD, or whatever it is, right? They spend tremendous amount of time, effort, and money. And don't you think, and wouldn't you think, that if they're in a system that is that is geared in one specific direction, right? Towards the petroleum industry, towards a financial control, right? There's a book called The $1 Trillion Conspiracy by Jim Marrs that explains a lot of the pharmaceutical industry backdrop behind all of this. At the end of the day, these are people that, sure, they sign up. They probably had dreams as a little kid to be a doctor. And as they indoctrinate themselves into that system, do you think they want the rug of life pulled out from under them? No, Grant. They believe in what they believe in, sure, but over time and slowly and surely as they proceed, they're not going to get that dream fulfilled if they don't play the game and participate in the system that they've put themselves in unknowingly. And there are a tremendous amount of doctors that still want to do good, like the doctor that just said, which one was it that got fired and said she got some high fives from some doctors, but
Dr.
right, but
Molly.
they didn't have the balls, they didn't have the backbone, quote unquote, to stand up like she did. Praise you, girl. You are what everyone needs to see, right? Those 17,000 doctors right now that are standing up saying this is a gene therapy, this needs to be recalled, this is not what it was told to be. And at the end of the day, it's like, at what point are there knowing and willing participants at the higher levels? And at what point are there just those honest, hardworking, I want to do good doctors without borders kind of people that are trying to do the right thing, but kind of caught up in it, right? There's that gray area of society and psychology that it's like, it's the same thing. You try to tell people, hey, listen, here's the facts that are all coming out by 17,000 doctors around the world, right? That have all come together. And there's these, McCullough and all these other doctors that have come out and said this, and people still don't wake up to it. It's something's going on.
And but behind all of that,
hold on a second. Ben, do you have kids, Ben?
Yes, and you know what? My 3-year-old wants to be a doctor.
Do you read them? Do you read them bedtime stories?
I do.
Dude, I can hear you read me a bedtime story.
That's a fact.
You drop your voice. You bring it up. They're back there. They're coming after you. Right?
Got you engaged, though.
He could make money on that thing.
I've done that my whole life, Grant. I've done that my
inflection.
whole life. I was in the public markets. I was a broker. I've lived on the phone. At the end of the day, it's about personal inflection and feeling the passion. I was one of those guys that would get under your table and when the whole boardroom is really loud and hold on a second, I gotta close the door. I gotta get behind her so I could, it's about perception. It's about understanding who you're talking to. But
yeah.
But look, we've gotta take a stand here. At what point are we just going to talk?
Can I make one more point, and then I'll drop.
Man, who the hell is that with that badass microphone?
Dr. Kevin, his mic is painful.
Dr. Kevin, I want to ask you a question.
You want to ask him a question? Let him fix his mic.
For his mic.
Yeah, he's going to fix it. He's going to fix, and Dr. Molly this, because I think then I'm going to back us up on his point. The average college debt's a little over $200,000 for med school students. And so if you got your whole profession taken away from you because you decided, sorry, I'm just choking.
Bro, we don't do Wi-Fi COVID in this space, bro. You know what I'm saying? We don't do Wi-Fi COVID, bro. You know what I'm saying?
Computer virus.
God
well,
dang.
I was just going to say, if you got your profession taken care of or taken away from you after 8 years and $200,000 that you spent for that profession, and your whole point was to do good, but the guardrails of what you were able to do and practice by change, and you're told from the top down that you have to change it or you're going to get fired, what would you do besides
while you have $40,000, right? While you're paying your tuition for kids' college and school, private school of like 40, 60 grand or something, right? You got a whole life to live and a family to support.
I just want to make one more point, and I know a lot of people aren't going to agree with it or whatever, but there's a spiritual element to this too, and that behind all of this, that there's evil spirits in the demonic realm, and Satan, he's the prince of this world currently. And there's a lot of deception. It says in the Bible in the end times that there's going to be deception that's far and wide, and I just want to bring that spiritual element into it. And then I think a lot of people that are well-meaning, but the devil has pulled the wool over their eyes as to what this is really all about.
Dr. Kevin, I have said that in spaces
That is
so
the point
often.
where this room. That's the point where this room jumped the shark.
Excuse me? You don't believe that, Jonathan? No, of course you don't. In the beginning of time, there started a battle of souls. Now you see in the music industry absolute
Vin,
insanity.
please.
I won't go there anymore, but I just want to bring that up once. That's it.
Was
Can I,
that Dr.
You got
Kevin?
to fix your mic, dude.
It's killing
can I
us.
answer the question about what do you do if you can't be a doctor?
Would
Because
love to hear that.
it's actually 11 years and a couple $100,000. And I actually had to consider this, right? Because I've been under investigation by a medical board now for 14 months with no accusation of wrongdoing. And what I decided is I can clean houses. I can go sell cars. I can do whatever, right? We are learners. And just because you've trained in one field doesn't mean that's not a translatable skill. So, if somebody like me can't have a medical license, our society has a lot bigger problems than if I have a medical license.
Amen, Dr. Molly. You've just got
At
brass
this point, I'm
balloons.
looking for a bunker somewhere in Nebraska that I can go hang out with my friends when Twitter Spaces gets taken down by the.
I'm going
By
with
the way,
you. Make that bunker big.
yeah, hey, it sounds to me I've seen some things popping up here and there that they're starting to kind of reduce some of these rooms or some of these titles. Has anybody else seen that on Twitter? Jimmy, have you heard anything about that?
I have not. I mean, I know that things have been glitching a lot lately. When our spaces get up into the 10, 11,000 range, that will sometimes get, pretty messed up.
Thanks for coming hang out with us little
heard
people, Jim.
that.
Thanks for coming and hang out with us on a little picnic here.
Yeah.
man, Jim got too big for us, man. He used to be here all the time, man. He went in flip flop. God damn, Jim.
I do not. Hey, seriously, I do want to say I feel really bad about it. I've been so freaking busy with clients and just doing the.
Man, here we go with that Provax talk, man. That's the same thing the Provax doctors do, man. Giving these goddamn excuses, man. Come on.
I came in tonight, didn't I, dude?
And we appreciate it, Jim.
We love you, my brother.
We love y'all too, man. Seriously.
Let's do it. All right, let's go to Julia. Jules, how you doing, Jules? It's good to see you in here. Let's talk about it.
I'm great. Thanks so much. And thanks for hosting such a wonderful space, hosts and co-hosts. I wanted to jump back to a question that was asked. I think this was when I first tuned in, was does ivermectin work to treat COVID? So it's definitely shown positive results in some trials against COVID-19 because it's inhibiting viral replication and modulating the immune response. At least that's what's thought. And I'm sure a lot of us recall hearing, the mainstream media and governments pretty much everywhere using the excuse that there was an absence of randomized controlled trials. So that's RCTs, which gave them essentially the fodder to dismiss ivermectin as a treatment. In my opinion, I think that the totality of the evidence over the past 2 years has really demonstrated ivermectin's efficacy, but I'm also a big fan of seeing data that proves it. So I'd seen this article a couple of weeks ago where a large randomized control study on ivermectin efficacy for preventing and treating COVID-19 that was released to the public ahead of publication in an academic journal. So like I said, that was about 2 weeks ago. And when she introduced the study, the lead author, Professor Colleen Aldous, she's a geneticist and a clinical researcher. She made a great point that the science is being misrepresented in mainstream media in favor of a skewed focus on the more negative studies, and that's been going on now for years during the pandemic. So, of course, those got a lot of attention, but then they were gaslighting studies that showed the actual efficacy of ivermectin. So just to quickly go over that study, it was a parallel group, double-blinded, randomized, placebo-controlled study involving almost 400 unvaccinated participants. This was last year, throughout the year. Participants were included in the study within 5 days after close exposure to someone with a confirmed infection. So of the 200 participants, that's half, that received ivermectin, 30 showed a laboratory confirmed infection between days 1 and 28 of the study. Of the approximately 200 who received the placebo, 105 showed infections in the same period. So it's 30 versus 105. So that indicates that taking daily oral ivermectin resulted in a 72% reduction in the COVID-19 infection compared to the control group. So that effectively, at least that study showed its efficacy. The author said, science has shown us a tool that could have saved millions of lives. And she was, of course, talking about that drug.
Yeah, for nothing, by the way. We wouldn't have had to shut the country down.
100%.
It cost pennies. It was available everywhere. we didn't need to raise $4 trillion. $4 trillion was spent on this, just in America.
Right. And
And
then
our kids and grandkids will never be able to pay back, by the way. None of this money gets paid back.
You know, I'll tell you the worst thing, and Vin, I think, brought up something related to fascism, and I think that there's something to be said about that. We're not quite to Mussolini yet, but there are people who would love to get there. We have a corporatism, which is really one of the fundamentals of fascism. We have a corporatism in this country that is outrageous. So, for example, I was just listening recently to Dr. John Campbell's YouTube on vitamin D and the numbers on that. Like vitamin D and zinc as a preventative, and then treatment, hydroxychloroquine and ivermectin. Like these are such simple, inexpensive applications of help. Had we not shut that stuff down early on, and by the way, it would not have helped everybody, but there are a lot of people who would have been helped by this. That we really have a corporatism where drug companies who have gotten tens of billions of dollars, hundreds of billions really worldwide when you take it all into account, Johnson & Johnson, Moderna, and Pfizer, and because we gave them the preference on a vaccine, which, by the way, vaccine science, I'm not a vaccinologist or anything, but vaccine science is such that you do that to help with herd immunity on the edges. That is not the way to go to herd immunity. Infection is the way. And of course, we knew that there were ways to help people
Jim, 4 or 5 months ago, you couldn't have said that on I don't know if you could say that on Instagram right now.
No, you cannot say it on Facebook right now. And Dr. Campbell has to be very, very cautious on his YouTube. You know, he has a very good way of getting the info out. But yeah, that's absolutely right. So the people in the worst, like people that were 70 and above, when the vaccine came out, you're like, okay, you probably want to consider taking it. I mean, based upon the information you had initially. And so you could consider that. But to throw it out as far as they did and to say that the vaccine was going to save everything and help everything is crazy. Now we know on the back end that they were totally fudging the numbers. They were totally wrong. And very interestingly, my friend James O'Keefe just brought out the worst information of all, that this is the biggest scam in world history. And that happens because of government. That's how this stuff takes place. That's why it becomes a problem, because we have built a system, particularly here in the United States. It exists in Europe too, and some other countries elsewhere, other free countries elsewhere. China's a different bird, but places like Japan. We built a system where we give special preferences to large corporations and or to well-connected corporations and other means, so that they can drive out their competitors and or get special advantages from the government. This is the big scam. This is just the biggest of them. But
Jim, this happens everywhere in every country, right?
Well, yeah. Well, so when in Federalist 51, you had James Madison say, if all men were angels, we wouldn't need government. I mean, and then he went to lay out the basic reason for government. Government is evil. By the way, government is legal force. We forget what government really is because we want government to protect us. Okay, well, there's a protection role with government, but there's no reason to have laws unless there's a purpose to enforce those laws. So therefore, the problem isn't the enforcement mechanism. The reason that governments enforce anything is ostensibly for the good. So the problem is the laws. Like, government has force. It's always going to have force. Our problem is, what is the construct of the laws we pass, and why do we do those? We do not follow constitutional government in this country, or else there would never be, for example, the Troubled Asset Relief Program, which a lot of people probably don't remember what that was. TARP, it was known by. This is where we bailed out big banks in the financial crisis after 2007 and 8. But here's the problem. The other government agency that was around, Federal Deposit Insurance Corporation, and I'm sure, Grant, you saw this all over the place too, that is medium and small banks were shut down by the FDIC because they said that their balance sheets didn't look good, which was a farce because medium and small size banks were not making loans right after that. They were all being totally responsible and saying, we're not going to make loans. It's not a good time. They were sitting on their balance sheets, on their loan balance sheets, and they were going to wait it out. But yet the FDIC shut those down. But hey, Citibank is too big to fail, so we got to bail it out. It's bullcrap. This is what we do in government. And those are the big players. And every one of those large banks should have failed. They should have gone bankrupt if they'd have made the bad loans. And we should have held politicians responsible who built the system that required them to make bad loans, by the way, and reformed that system. And that's the problem we have. That was not a specific test run with knowledge of what was coming with COVID, but it was a test run because no one reacted to that problem. And now we got government coming in and doing something else. And that's why we have a Pfizer vaccine that is absolutely harming many, many people, even with whatever benefits, and there are some, that were there on the back end of it. But it's harming people, and these corporations go hog wild and do whatever the freak they want because they know that no politician is going to oppose it, or at least not enough that have power, and certainly not those in leadership in the legislative bodies. That's a crime. It's a crime against humanity.
Just wanted to add, because Jim mentioned James O'Keefe, Project Veritas had uncovered DARPA documents, I think it was early last year, indicating our government knew ivermectin was, quote, curative as early as April 2020, and the same for hydrochloroquine.
Yeah, and listen, and James has been a friend for many years. I got really close to his organization a while back. Peter Schweitzer told me I needed to call James one day, and so anyway, we built up that relationship, and I see what James does, and he's a really interesting guy to know him personally, just very, very interesting. But what's really significant about that is it takes a guy like James O'Keefe to do the types of things to reveal what's really a problem and what's really at stake. By the way, it takes a Peter Schweitzer too, who's done, and I have a good relationship with James, but Peter's like a close friend of mine. And I'm telling you, he's affected everything. He's exposed everything bad himself that goes on in government. And I helped him get some of that information at one time too, just as a friend. We'd been friends before that. But I'm telling you, we need people like this. We got to support folks like that and then carry what they say, because if we do not, then we're all sunk, because we have a media right now. By the way, I don't, on my Twitter, I probably should share it in the nest, but on Twitter, I shared today, I saw a CBS article. It said, suspected Chinese spy balloon shot down over, and I'm sitting there saying, no, wait a minute. We had the Biden administration say it was a Chinese balloon.
Crazy,
we had the Chinese
say
it was a Chinese balloon.
Crazy.
It's like, what the freak is this? Who are these people?
Exactly.
It's nuts. And so we are really in a bad place if we don't keep pressing forward. And I appreciate what you guys do on your spaces, and I'm not blowing you off. I know Nelson's playing with me, but this is really important, the discussion we're having here right now.
Yeah, and I appreciate you being in here, Jim. And I find that I saw that CBS thing today too, and I'm like, come on, man, guys, it's so obvious now.
It's
and when I see guys
crazy.
like Bobby Kennedy, I searched his name tonight, and you see pages after pages after pages of, he's this, he's that, nothing good. It's impossible. These are scrubbed. These are completely scrubbed. Okay. Like it is so obvious, guys. Sometimes you just got to look for what is not there. Let's go to Remakey and then Joanne. They have their hands up.
Let's do it.
Good evening. What a fantastic discussion. This is Monica Ricky up here in the turquoise circle. And, gosh, so many thought-provoking comments tonight. The first thing I want to say is I still have my tonsils. I'm Gen X, and I have my tonsils because my mother had a healthy skepticism of medicine back in the 60s. And so this is such an interesting and long history of people distrusting medicine to some degree. And as Barbara said, and lots of others said, there are so many good doctors out there. And so we don't want this to be an doctor room, but it's really interesting how things have divided the medical community and really sort of exposed the challenges that the medical community is facing between having to choose providing for their family and honoring what they know in their heart and soul and gut to be correct and to be ethical. So that's been an interesting thing to watch. The Dr. Drew Pensky worked with Dr. Fauci in the 80s around the AIDS thing. And interestingly, in the beginning of this pandemic, Dr. Drew had been saying, because I was sitting on his live streams with him at that time back in 2020, he was saying, Dr. Fauci, you'll see us through this. Dr. Fauci, you'll be our North Star. And Dr. Drew really, truly believed that. And what is interesting is if you've seen any of Dr. Drew's live streams lately, which he's been doing them consistently for about 2 years now, he has now joined the ranks of those who are open to maybe seeing this for more than what it appeared at first. And so he's had on many, many experts. And I think that he would be a wonderful addition to this room. And I'll be happy to text his wife and ask if he would do that if you'd like me to. But he's had on so many professionals, Dr. Kelly Victory and just so many guys and women on who were talking about everything from the virus itself to Dr. Fauci, to the jab, to the blood clots, to the shedding of vaccines, to sudden death and everything else, right? So that's an interesting aspect as well. And what I find fascinating is how, as again, I always use the phrase unholy alliance. There's this unholy alliance that we've known that it's been there, but it's never in my lifetime, and I'm kind of old, it's never been so obvious and so dismissive of the American public. It's like they don't even hide it anymore between government and media and big pharma and big tech. They don't even hide it. And what's insulting to me as a taxpayer, and should be to every one of you in this room, if you're an American taxpayer, is the way that your tax dollars have been used to propagandize this, what they call a vaccine, for the benefit of big pharma. They're using your tax dollars to advertise this thing to you and your children and to spin it like crazy so that they can line the pockets of big pharma. And it's just disgusting to me what has been illuminated these past few years. But you know what else has also been exposed, and which is hopeful to me? I like to end on something positive. The past 3 years have also exposed how we do need to advocate for ourselves, how we do need to stand up and say, no, I will not do that. No, you will not do that to me or my children or my family. We will band together. We will, right, not stand for just being told what to do anymore, because we are smarter now than we were. In the past couple of years, I've also exposed the fire and the spirit of people who realize that they've been played, lied to, coerced, and deceived by entities that we used to think we could trust. And I am so grateful for this room. Thank you so much.
Absolutely. Absolutely. Well, thank you for being here, and thanks for jumping in.
She throws down, that girl right there.
Man, that's my girl. That's my type of girl.
Wait, I was going to claim. I'm claiming Monica. I found her first.
What's
Thanks,
wrong with
Monica.
you, Bash? Why are you stealing my shine? Oh. Let's talk about it. Let's go to Joanne.
Hi.
Joanne, let's do it.
Hi. Thank you so much for this space. I never thought I'd have a chance to share my story amongst so many people and be able to reach such a broad spectrum of experts. First of all, Monica, I also have my tonsils. And so, there's something to say for being durable. I have a slightly different story, which I hope you can appreciate. In 2016, I moved to Philadelphia because I was working on continuing my education. I went back to school. I was working on my bachelor's degree. That became divine intervention because in 2017, I was diagnosed with leukemia, AML. I had immediate treatment with chemotherapy. I had wonderful doctors. However, in 2018, I relapsed and I had a bone marrow transplant. It went well. It went really well. It was very successful. I do have what's called GVHD. I had acute, and then what's chronic. That's GVHD is graft versus host disease. And there's a series of medications that I'm on. And, of course, over the course of my treatments, there were many transfusions. So I did have a couple of bouts of blood clots. I had DVTs, I had renal vein thrombosis, that sort of thing. And, but as I was being taken care of and I was doing great, COVID hit, and our cancer center, got in touch with all patients and sort of, if you want to put it in quotations, fast-tracked, giving us an opportunity, because it was taking weeks for people getting appointments. They were kind of streamlining and putting us to the head of the line if we wanted to get vaccinated. And so, thinking that I'm older, I went through this, I'm immunosuppressed, I have older parents, and I was planning on returning. I actually live in Florida, but I was going between the two states. I thought, well, let me find out what this is about. And my oncologist, I asked him, and of course he used the same quote that every doctor I have used, which was, there was robust research. And I said, well, put me on the schedule. The next thing I knew, I was getting an email saying that you have this appointment, but we need an informed consent signed before we can give you the vaccination. And they sent the form, and then they sent no information. Now, being anybody who's been in the hospital or been treated for many things, you are constantly bombarded with paperwork about every single medication, every IV, everything that you take. And I received nothing. So I had this little sneaking suspicion. And then it was at that time that I heard Dr. Stella and the late Dr. Zelenko about their alternative protocols. Well, how coincidental that many of the drugs that I'm on, besides my GVHD medication, happen to be an antiviral, vitamin D3, vitamin B12, vitamin C, and the list went on, and a blood thinner for the previous clots. So I said I refused. And I have not had so much as a sneeze. I've traveled between two states, every possible mode of transportation. I've lived, apartment, hotel, 2 different apartments, the hospital itself, and I had so much as a sneeze. So when it came time for, I received a couple of calls from cancer centers that were doing research on COVID. And when I said, I would love to participate, and they said, well, when did you get your vaccination? I said, well, I didn't get vaccinated. No, I'm sorry. You don't qualify. And I said, why wouldn't you want to have at least, some patients that weren't vaccinated to see how they were able to get through? Because I've been fine. That was one. Second, I happened to have gone to a school where 6 or 8 months later, I received an email from the alumni talking about how our medical school had a doctor who was researching all the antivirals to find out which ones might be helpful for COVID. They wouldn't listen to me as the patient, but now suddenly it was being handled through the school, but as if nobody ever brought it up before. And lastly, when I came home, I'm here in Florida, and I did my due diligence in researching more school. I wanted to get into a grad program. I got accepted to an online, that's very important, an online asynchronous graduate certificate for what was called narrative medicine from Columbia. And after I gave them my deposit, 3 days later, I was informed that all students needed to be vaccinated. It didn't matter if you were online. It didn't matter that I was 1,600 miles away. It was mandatory.
Online students had to be vaccinated?
Absolutely.
Well,
that was only after I had given them my deposit.
How much was the class? How much was the class?
Well, No, the program is like 10 grand, but I had to put my deposit down to hold my space. And that was like, nominal. It was just a few $100s. However, the fact
Yeah. We actually gave discounts to people that weren't vaccinated.
Oh, and no, and I got penalized for that. I got penalized and I was refused an opportunity to, as a cancer survivor, to go and work with cancer patients and be a navigator and a, advocate for them. That was refused to me.
Yeah.
And you know why? And this was the last of what I have to say. And thank you for the time. But it was because
100%.
every doctor I had who had known me for the last 4 years and saw how I got through all my treatments, I did well, I'm doing great, I'm 100%, not one of them would write me a medical exemption because, and they didn't say this, because again, the robust research would say that they couldn't in good conscience write me an exemption. What I know to be a fact is that government put the fear of God in every single doctor that they were going to be axed and they would be canceled and they would no longer have a license. And when you start threatening doctors, they all think they're going to have a target. So I have been refused so many great opportunities because not one of my doctors, and they wouldn't take, I couldn't say, this doctor give me an exemption.
Wow.
I had to have a history with with those doctors. Anyways,
That's crazy.
Well,
That's crazy.
I want to say thank you because
Yeah.
I think it's I think it's a unique story and perspective. And to this day, I'm doing great. I'm doing my meds. I'm fine. And I do have all of those, the zinc, the vitamin C, the B, and the D, and sunshine.
100%.
I got sunshine. So thank you so much for letting me share. I appreciate it.
Now you got some GC. Now you got some GC. So
100, man, you got to stay on those meds, man. Very important. Absolutely.
awesome. Thank you, Joanne.
Let's go to Dr. Mike. Dr. Mike, let's talk about. By the way, if you guys in the audience,
request. Yeah.
Yes, if you guys in the audience, you want to get on stage, please hit the request button so we can go ahead and rotate. There are a lot of speakers on stage that aren't speaking. Okay, so hit the request button and we'll bring you up. Dr. Molly, how are you doing?
Hey, I'm awesome. You guys know I've been in this space a lot, and I don't really promote my clinic at all, but I did post something in the Nest, and I wanted to point that out and ask people to follow. So that is a gentleman named Gary. Gary's in the audience right now, I believe. His story came across my feed and caught my interest, and I found out that he was local to me, and I reviewed the symptoms that he's having from vaccine injury. So what I did last weekend, I think it was, is we did a 1-to-1 give, send, go match. So all the funds that we raised for him, my clinic matched 1-to-1, and he was able to come into my clinic last week. And if you follow him, you can follow his story. So I'm pretty pleased with how he's doing, and I just wanted to point that out.
No, definitely appreciate you, Dr. Molly. Let's go to Vin. Vin, what you got for us today, man? Let's go.
So, Grant, you mentioned Bobby Kennedy, and everyone, please take a look at what he's doing. The Children's Defense Fund is one of the most important things being done today to save our children who are the innocents. They are the innocent ones in all of this and deserve none of this tyranny. He told everyone on stage publicly that since the mandatory vaccination panel for children to go to school, the 6-in-1 and this and that was implemented, I think it was 91, if I'm not mistaken, the percentage, the number of metabolic and systemic disease throughout the population has increased over 10,000%. Please take a hard look and see and support him in what he is doing. And that's exactly why they're suppressing when you searched him, Grant, and you didn't find anything except for negative information because of the corporateocracy that's going on here. To the woman who mentioned taxes, Unfortunately, our tax dollars only go to paying down the debt. It's the dollar inflation and the printing press that the government uses and the bonds and all this other Wall Street stuff to get that money actually, which actually pays for all of those things that you're talking about. As they keep increasing the debt, we've got issues, and that's really where all of the tax money really goes towards international debt. Now you see Japan is the number one holder. People think it's China. It's not. They've been selling our corporate debt, and that's why you're seeing this whole petrodollar thing happen, and they're changing the way that they're doing oil transactions. But
Yeah.
Japan is the number one holder, and you're also going to see that their military is the greatest that they've ever been in Japan. And then the third thing I was just going to say was what happened to the ODs? Does anyone know? Like, my primary doctor is an OD and a osteopath. Does anyone know any ODs that have suffered throughout this time? Because those are more natural medicine doctors, and I'm just wondering if anyone has, because I think they're the
Just
greatest.
for clarification, what's an OD?
An osteopath. It's like more of a natural doctor compared to like a medicine, like a pharmaceutical like doctor. Like, they still can prescribe medicine, but they go about treatment in a different way. They actually go, more towards trying to treat the underlying, fundamental reason of why you're sick, not just putting a Band-Aid on. So I was just wondering if anyone knew anybody or have any stories about any osteopaths that have been suppressed during this time.
I am.
All right, let's do that. Dr. Molly.
I am. I'm a DO.
Oh, it's a DO? OD? What is it? DO?
It's a DO. It's a doctor of osteopathic medicine. Yeah. An OD is an optometrist.
I'm sorry. I got backwards. Yeah.
You getting your shit wrong, man. God damn. Okay. Dr. Molly, do you want to speak on it? You want to speak on his question?
Yeah, so Sherry Tenpenny comes to mind as somebody, and that caught my attention because after testifying in, I believe it's the Ohio legislature, actually the AOA, the American Osteopathic Association, came out against her. So I would say that the DO profession as a whole has been a sellout, just like the MD allopathic counterparts. So I think there's good and bad of everything, and our little part of the world, we're about 10% of doctors, is no different.
Dr. Mike, let me ask you a question, right? Now, within other physicians, right? I guess the board of physicians or whatever you want to call it. What would you say is the ratio between those that believe in vaccinations, specifically the COVID vaccine, and those that don't? What is that ratio as of today?
I think that's really hard and probably a moving number because, again, going to that, we were taught that this is what it is, and it was never even a question, right? It's just, here's the childhood vaccine schedule. And as it changed, it just changed. There was no discussion pro con or anything. And I think a lot of people like me who just did what we do to get through, now we're stopping and looking at the data and maybe evolving our opinions of that a little bit. So, but I do want to mention something crazy. And I think I brought this up before. It's actually a Medicare mandate in the ICU. Or a JCO quality measure that once a patient's admitted to the ICU, they get a pneumococcal vaccine and a flu vaccine. And that never made any sense to me because when you're critically ill and we're trying to figure out, we're treating and trying to diagnose at the same time and figure out what's going on. And then we're going to add another variable into the mix that could cause a fever, inflammatory response, and add tens of thousands of dollars to the workup. So that's really my only experience where I had an opinion is like, get those out of my ICU, wait till the patient is better and comes back. And then if you want to do something, do it at that point in time.
Wow. That's very interesting. Who would like to speak on that on the stage?
I have a question about that, Dr. Molly. Is that, do they consent to that vaccine or is it just administered?
One thing I'll say to that, or expand upon it a little bit, and I'm curious, Doctor, your thoughts on this. I had 4 friends that were intubated with COVID. 1 survived and 3 died. And of course I understand why people thought through intubation. Obviously, ox levels are critical for health, but for anything else, and respiratory disease, really bad problem. I get that. So, but it seems to me that there were a lot of things in ICU that went way, way too far after a certain amount of time. And I got to the point when the last two people, the last two of my friends that were intubated, and they put them under and intubated them. The one they said had a 10% chance of living, and he's fine now. He's like totally back to normal. The other guy died. I didn't think either of them needed to be intubated. I got COVID in January of 2021, and at the same time my other friend got it, and he died, but he had a lot of complications. I did not go into the hospital, but there were a few nights where I was waking up feeling like I was drowning. But I didn't go in, and I'm glad I didn't, because I, in hindsight, wonder if it had taken me out. But I know that my ox levels were way low. I wasn't taking them at the time, but I know they were way low. Is there any sense here that there came a point where we were just overdoing everything, even putting people in ICUs? And by the way, I was popping vitamin D and zinc regularly leading up to and during mine. But anyway, is any sense of that in your mind that we went way overboard in a lot of these in-hospital
How about the
treatments after
incubators,
about a
Jim?
few months? Yeah?
How about the incubators? Because those were
No.
those were
The
completely wrong.
intubation. That's what I'm saying. Intubation.
Ventilators. The ventilators.
Well, the intubation is on a
the incubation.
ventilator.
I'm sorry, the ventilators. Yes.
Yeah, this is my
If
specialty,
you're
so I can.
intubated, that's for ventilation. Yeah, go ahead.
Yeah, I am an ICU doctor, so this is my shtick. Let me answer the first question, which is, do people consent to getting the shots when they get in the ICU? And the answer is no, they just get them. It's part of a hospital protocol. It's an automated order set that just appears. And so when I would tell the nurses to hold that injection, the vaccines. So that's just that component. As for the ventilators, this is a complicated question, and I would have to say that throughout the pandemic, things evolved, right? So I worked in like 10 to 12 different ICUs, 3 health systems because of my unique job. I never saw anyone intubated inappropriately. Okay. So when somebody's breathing 50 and 60 times a minute in front of you, they're going to stop breathing. They're going to wear out and fall off a cliff. You have to remember, when you put someone on 100% oxygen and you check the level of oxygen dissolved in their bloodstream, the number is like 500. These people were coming in and their oxygen, that number, instead of being 500, was like 50. So if you're below 200, the mortality of that is 40%. That is considered ARDS. So the people that were making it to the ICU were way beyond ARDS. So once they arrived there, there were no other options than to do what was done. But I would say as the pandemic evolved and we learned about early treatment, if they would have done early treatment, those people wouldn't have ended up there. But once they're there, right? Once you've missed that window, you have to deal with the patient in front of you. So I don't think things were done incorrectly, and I've defended that pretty consistently since the beginning.
So let me throw this at you, because I agree with all that, and even not as a doctor, I get that. I mean, you get to a certain level, you have to take action. But it seemed to me that a lot of people were going in long before they got to that place in their respiratory behavior, and then suddenly went down, but they weren't getting any treatment that was helpful. Now, listen, in 2020, I get that. Like you're still
totally
figuring
agree
it
with
out.
you.
But
Totally
2021, you're still doing this doing intubation,
yes.
And it's like, well, wait a minute here. Let's and I'll say this. So the one friend of mine who died, of the last two, his wife, who they barely let into the hospital, which is another issue you could get into, but his wife was begging to let him get onto ivermectin, like early on going into the hospital, and they absolutely refused. And we can argue about all that, but nobody was doing anything but intubation, as best I could tell. Like, you didn't have any kind of treatment regimen going on in the hospital that seemed substantive, except to monitor them and see if they have to be intubated. Am I missing that?
Jim, could I
Don't
speak? Even I'm
don't
not a
forget about
doctor, but
don't forget about remdesivir too. That was another
yeah,
problem.
there were monoclonal antibodies for a while, although now apparently they are not
Well, they took them
effective
away
against.
in Florida. Like they
They are not.
refused to give them to
Yeah, but
Florida.
what I'm saying
So
is right now they are not apparently effective against the most recent variants. That's what the science seems to say. I'm not a doctor, so I'm not going to go there. I do think, look, my son-in-law is an emergency room doctor, and we spoke obviously all the time. And I will say, and thank you, Dr. Molly, for what you did. I will say that I think emergency room doctors have been real heroes in this, and I don't think they're not getting a lot of extra money out of this. It has, I mean, when my son-in-law basically tells me how many people were intubated, how many people died, it's not, he's not sitting there going, oh wow, it's just was horrible. We learned a lot, as you mentioned, during the start of the pandemic. People were, I think, put on ventilators probably too quickly because apparently with COVID, you can have a slightly lower level of oxygen and still survive. But we learned about that. But when I used to talk to him about, I didn't get sick during this time, but when I would talk to him about it, what he basically said, and when my children also got COVID, he said, do not come in. Do not come in unless, check your blood oxygen, but don't come in unless X. And even if it gets low, chances are they're just going to give you oxygen. In other words, people were not, I don't think at a certain point doctors were telling people to go into the hospital. Do you know what I mean? I really, truly don't. I think they understood that once you're in the hospital, there are few things to do, and if it goes too bad, it's bad, right? I do think we did have some things, like monoclonals that apparently worked for a while. I had a friend who had cancer who was given Evishield, I guess, which apparently now is no longer once again effective, but it was sort of something like a prophylactic of some kind. But I think it's been hard. And I really do want to say about emergency room doctors that honestly, I just don't like the bashing of doctors because I think most doctors are really just trying to save people. Thank you.
Well, to be very clear, I'm not bashing doctors. So, 1. 2, the monoclonal antibodies, even in 2020 when they were coming about, and by the way, Donald Trump had monoclonal antibodies as well, reportedly, but they were not widely made available. I do recognize that some manufacture of that would have been challenging, but you were having such high rates of infection around the country and so many people willing to do things. The
to get the
monoclonal
emergency order,
antibodies were
Jim,
never pushed hard.
and that's because they wanted to get the emergency orders. So what I understand now is that they had to kill the alternatives to get the emergency orders passed.
That is not true, Grant. The EUAs were for vaccines. You could have a vaccine and a treatment. They are two different things. One is supposed to be prophylactic. The other is supposed to be treatment.
The vaccine law was read tonight.
No.
In this
He
room.
read it. He read it and he didn't understand it. It does not say you can't do it.
You're the only one that understood it. You mean I didn't understand it when he read it either?
That's correct.
You're the only one in the room that understood it.
You did not understand it. It does. We have Paxlovid.
How do you know I didn't understand it?
Because of what you just said. We have Paxlovid now under an EUA.
How do you know I'm just not lying?
Well, maybe you're just making. Look, maybe you didn't understand it.
You don't know.
Grant, what you just said was we can't have both. That's not true. Right now we have Paxlovid under an EUA for treatment, but we also have certain vaccines that are still under EUAs. You can have both because they are different. They are doing different things. Does that make sense?
Does it strike anybody that the monoclonal...
It makes sense to you because you have a bias that you're trying to...
This is not a bias. I'm just telling you that what he read...
How do you know it's not a bias?
Because you can have both, okay? There's nothing in what he read that said you can't do both. One is a treatment. One is supposedly a vaccine, which is a prophylactic. They are different things. Thank you.
Does it strike anybody as odd that the monoclonal... Oh, sorry.
Tara.
Grant. Oh God.
But can you have an EUA if there's an effective treatment?
No,
you can't. You cannot.
So that's what we're saying.
That's what everybody else here understood that you didn't understand.
I
you
do
don't
not
want to understand.
Can
you
say
that other
that
people
to me?
don't understand it, which is your
show that
elitist
to me?
bullshit. You're the
no,
smartest
can you
person
show
in
that
the room.
to me? I'm not the smartest person in the
room.
room.
We read it to you tonight. You were
no,
here when it was
He
guy
put it in the nest too, G.
Right, but it didn't say anything about whether you can have whether what treatment is the same as prophylactic. And I'm really asking, does anybody really know the answer to this, or are you just saying it? Because as a lawyer, I listened to that and I said, I don't see any reason why the two of these
as a
can't
lawyer,
exist.
as a
No,
doctor, as a
it did
biologist,
not say.
as a pretend to be doctor that works for the government.
I
I've
am.
heard all these lines over and
I'm
over.
not a doctor. I don't work for the government, and I'm not a pretend
No, but
lawyer.
there's similar lines. There's similar lines. As a
You're a
doctor, as a
retired lawyer,
professor,
Kira.
That's correct,
as the
Kevin.
professional in the room.
Can I?
Professional
Very tired.
legalese.
Very tired, by the way. Very
Can
tired. Not retired, but very tired.
Can I talk about
and that is an attack on lawyers, by the way. We're not attacking doctors here, but I do welcome the room attacking lawyers.
Except for Kevin.
Hello.
No, you could. No, please attack Kevin if you're going to attack lawyers.
I'm one of the good ones.
I own 12,000 apartments. If I never rent an apartment to a lawyer, I would be completely happy about it.
Except for Kevin.
I can't say that I discriminate against lawyers, but I will do everything I can to make sure that we don't approve a lease for a lawyer. You guys can clip that.
Yeah,
that does not follow the equal housing standards.
I've heard it said too many times that you got no EUA if there's an effective treatment, and that was why these treatments were suppressed. I wanted to shout out to Dr. Zev Zelenko, who started the Zelenko protocol of hydroxychloroquine and zinc very early on. This was like April of 2020, and he equated himself with a soldier in the trenches that found a secret weapon against the cause of the war. And when he ran the information he had up the flagpole, it got suppressed. But he kept on anyway, and thank goodness that like Rand Paul instituted a thing where you could order drugs, get drug prescriptions across state lines, because I lived in Nevada, and when I got COVID, my doctor was a DO, and he researched Dr. Zelenko's, and he actually wrote a paper on hydroxychloroquine, and the AMA or whatever organization made him take it down. The whole early treatment thing, it was absurd. When I got COVID, I had the health department call me and say they wanted to make sure I didn't go around and spread it anywhere, to make sure I was staying at home. And I said, well, what about hydroxychloroquine? And he goes, well, we're not really sure that works. And I go, well, if my options are waiting till I turn blue and go to the hospital and get killed by them, why can't I try it? And they had no answer for this. And so I researched with Dr. Zelenko about hydroxychloroquine. It's like, okay, zinc inhibits viral replication. Hydroxychloroquine is an ionophore that puts zinc into the cells. Explain to me, doctors, how that couldn't work, why it wouldn't work. And Dr. Zelenko explained the early treatment. He says, look, hydroxychloroquine is like a wet rag on a kitchen fire. When the pan first starts on fire, you throw the wet rag on it and you can put out the fire. If you wait until the kitchen is fully engulfed, the wet rag isn't going to do you much good. So it was important to get hydroxychloroquine and zinc and get on the protocol within 4 days of symptoms occurring. And all the tests were done inpatient where the fire was already raging. So, yeah, I just wanted to shout out Dr. Zev Zelenko, who passed away, unfortunately, but his brother's still alive, and I invited him to this.
May he rest in peace.
Absolutely. All right. Thanks for the time.
So to his point, we did use hydroxychloroquine in the ICU early on, right? In March and April 2020. We were using hydroxychloroquine, zinc, all the vitamins. There was one consensus that said don't use steroids. All of the professional organizations said that. And then toward the end of summer, we found out that it was an inflammatory condition in the lungs, not an active viral infection. And we found out people were clotting. So we added steroids and we added blood thinners to that. Now, to Jim's point, the steroid dose that we added is modest at best. So once the patients got into the hospital with cytokine storm, they were completely undertreated. And in early 2021, I started using ivermectin, but the doses at that time were low. And the reason that the doses escalated is people in Africa were overdosing on ivermectin. And what happened is they got better faster. So that's how we got to these accelerated doses. That's the work of Jackie Stone.
Yeah, in my mind, in anything in excess can be a problem. But when it came to it is amazing that we went through this with the hatred of hydroxychloroquine and ivermectin, which, by the way, I just want to make clear. I mean, I think should never have been rejected, but guidelines should have been put together from experience. It's not; those were not a panacea by any stretch of the imagination. And then things like vitamin D and zinc, which, by the way, John Campbell's thing that he recently put out, and he went through the science on vitamin D, is incredibly impressive. What it provided, and I always take vitamin D anyway. I sit inside a lot during the day. I'm not out in the sun as much, particularly in the wintertime, and so I take it. It's really incredible, the positive science around vitamin D. We've been talking about it for 3 years now anyway. Same with the hydroxychloroquine and ivermectin. And it's like, if you put those in appropriate doses, it doesn't harm people. Like naturally, like even if they didn't need it, you could give it to them and it doesn't harm them at certain doses. And you certainly could have done the biggest trial of that ever, which I think we did in Africa, where the numbers I've seen show that the COVID numbers are fairly low in most parts of Africa because there is regular taking of hydroxychloroquine, and
they take it for malaria.
These are things we should have done for a long time and looked at it, but no, we politicized it.
Yeah, and to the early use of hydroxychloroquine, again, we were kind of in the ditches, right? We were in the heat of it, and the reports came out that people were having cardiac arrest from the hydroxychloroquine, and our patients were having a cardiac arrest, and it wasn't helping. So when you look at risk benefit and what you're going to use, there was a reason that we stopped using it in the ICU. And obviously now we have a lot more information and context to that. But just to put
Dr. Molly, were they having
and for people that weren't in the hospital yet, doctors could have made the prescription early on, because you're probably have, I mean, correct me if I'm wrong, doctor, but that heart reaction could have a lot to do with exacerbating circumstances because of getting to the ICU. Leading up to that, I mean, what's the chance that you would have that same problem?
Totally, right? It was just the severity of illness also. But when you're seeing a drug that's not making a clinical benefit and potential harm, you nix it, you get rid of it.
Yeah, I agree, but you don't have the FDA say you can't use it. You lay out the guidelines. Yeah.
Correct. That was totally out of line.
In Nevada, the governor actually banned hydroxychloroquine for outpatient use. So it was only allowed to be used in the hospital after it was already too late, after people are already suffering from the cytokine storm. So it was already too late for early intervention treatment, and it was illegal. So pharmacists wouldn't fill prescriptions.
And this is the basic problem. So what we should have learned, and I'm hopeful we ultimately will learn, but I don't think we've gotten there yet, is that when you're going through something like this, you are in a large science project that was forced upon you. Like it's not, I mean, who knows, maybe China wanted to create it, but that we don't have to get into that issue right here. But beyond, what might have happened with Wuhan, once it's happened, it's a large science project that you didn't plan, you did not want to go through, but now you just got to science the heck out of it. And we didn't do that. We said, and what makes this worse in my mind is that every action that was taken at the federal level and with many governors in the states, but mostly at the federal level, was for the benefit of a pharmaceutical company. The hydroxychloroquine and ivermectin, and then even if you had prescribed it, obviously over the counter, or recommended it as a doctor, zinc and vitamin D in whatever appropriate way that a doctor would have recommended it, all of that, had we done that, would have taken care of a large part of this problem. We know that now by the science. We know it for a fact. And it would have taken care of a large part of the problem, and pharmaceutical companies would not have made much money. And that's a real problem, Pfizer in particular. Like, these guys have brought in tens of billions of dollars just on this alone. And on their prophylaxis and on their viral treatment. And this is something that, and I would have been fine for them to do things. Like, I'm not against Pfizer and Moderna and Johnson & Johnson doing all their research and trying to come up with vaccines. Vaccines are I'm not an anti-vaxxer. I'm not I'm not keen on taking vaccinations
I
for
am
most of my
now.
life, but I'm not against it. Well, I don't think there's any reason to be anti-vax. I think there's a reason to be against vaccinations that go through this process as we see it. See, this is one of the lessons that we've learned. We need to recognize that that is a problem. Then we should never do that again, and we should do more rigorous work. See, doctors everywhere are scientists. This would have been a great opportunity to restore the medical profession to rigorous science. Now, every doctor is a scientist. They're trained to be a scientist. They're trained to observe. They're doing the basic work of science, which is classification. That is the job of a doctor, is classification in the Aristotelian method. And now, had every doctor been given the encouragement to say, okay, tell us what you're finding out, report back, let's figure it out, and do it in mass, maybe with VAERS or whatever system we might have created, or just word of mouth and discussion, written down somewhere. Just think of what that would have done to restore the academic nature of the scientific profession, which I think would have been a benefit. As it was, it was dictated. Doctors were told what they were to think. They were told to shut up if they disagreed. And I think we've set back the scientific nature of the doctor profession many years by doing that, because now we have a lot of doctors out there, mostly out of fear, who are afraid to question, and that's a real problem.
But Jim, doesn't the Bobby Kennedy statistics that he states when the vax panel requirement for children was implemented in 91, and the absolute devastatingly increase in disease, how can that not lean you towards being against vaccinations and on that level? Or does it? And I just misunderstood what you just said.
It does not. I mean, I'm going to tell you why. I have respect for Bobby Kennedy. He's not perfect, but he has done tremendous work for decades, and he's to be applauded for what he's done. But let me say this. I'm answering your question. Let me answer your question. But I will say this. Vaccines, the whole science of vaccines, that we owe to the efforts that went into the polio vaccine. Primarily, there were other research things going on, but that was the big one. Has been one of the greatest benefits to human society. Now, if we can pull out certain vaccines to show where the same process...
Well, Jim, why have they been such a benefit to human society?
Yeah, what have they done for us lately?
There's a difference between the polio vaccine and the 6-in-1 vax that is given to a 1.5-year-old child that bombards it with chemicals.
Listen.
I don't know, Jim.
I get it.
Jim,
I'm in agreement with you. I'm not disagreeing with you on that.
I know, but Jim, there's no, you just said that they've been a miracle.
And you use the polio as the example as to kind of why you're not against the
well,
major
can I just jump in? Let me just
vaccines.
jump in on this.
Wait, I want to hear his response.
Your question. Yeah, I got a response for you. Let me answer it. So, polio and smallpox are fantastic representations of the advancements of vaccine research and implementation that we should applaud. It is a scientific breakthrough. Very positive. Here's what the problem is in recent years, because I agree with all of you that the 6-in-1 is absurd. Okay, and so I get that. Individual instances of the implementation of vaccines have become more and more problematic, in my opinion, because of the FDA. By the way, I would get rid of the FDA. I would have the FDA stop being a government organization and have it be something like Underwriters Laboratories. And it would take it would be a little more fine-tuned scientific process than Underwriters Laboratories are, because it would go beyond testing. There have to be rigorous scientific research. But get it out of the government, because right now the FDA benefits certain pharmaceutical companies under certain circumstances. And small guys, particularly people that do nutraceuticals, where we need more research, by the way, and so we can learn more about the manufacturing process and the true efficacy of things that go on the market, because there's a lot of crap there too. There really is. Although I'm all for that industry.
Yeah, but Jim, back to the vaccines being the greatest thing that mankind's ever had. I mean, we got allergies at all-time high rates. We got ADD, ADHD. We got dementia.
Yes.
We got
autism.
That doesn't really go into the vaccine thing.
Well, sure it does. Sure it does, Jim. Just because when I Google it, I can't see any attachment to the vaccine. Just because I see everything cleaned up. No, there is no proof. That kind of energy, there's no proof that there's ever been any complications with autism or dementia because of the vaccine. I can't trust that.
I'm on the side of thinking there is problems with autism when it comes to vaccines. I seriously believe that. Yeah. That's one of the areas that actually has been shut down in recent years. But why has it been shut down? And this is where I get to the point where I think we agree more than you think.
Because it's true.
Okay. But I can't argue the autism thing. I'm just telling you, I'm asserting to you that I agree. I think it's related to vaccines in some way.
So you're walking that thing back. You're walking it back about the vaccine being this great thing.
No. Vaccines are still one of the greatest things that we ever did in the medical and scientific profession. The problem right now is that, first of all, we've taken liability away from vaccine manufacturers. That should never have happened. There's no circumstance under which that should happen. Ever. But that's a government problem. We also, exploding onto the scene with what just happened here, we also are giving special benefits to certain companies under certain circumstances for their drug to go through at the expense of others. That is a government problem. That's why I would take the FDA out of government control and make these companies submit in a similar fashion to what companies do with Underwriters Laboratories into testing. I think we got to take that out of the government control. There's no use for that in government.
Jim, can I ask you? You said it was a government problem.
Let me finish up. Yes, you can ask me a question. And then thirdly, we have created laws, not just when it comes to immunity for liability, again, which should go away. We create these laws that give benefits to large companies in this process and do nothing to help smaller companies that are being innovative to do anything. The result of all that I just described is that vaccine research now is worse than it's ever been. And we've got major problems in the areas of vaccines because we approve these things for the benefit of large companies, and then we don't hold these companies liable if they do wrong. And that is why in recent years, what Bobby Kennedy's talking about, that I fully agree with, I have for decades agreed with almost everything that he has said. And this is a real problem. That's the state of vaccine research right now. But that's throughout the medical profession. We've got a whole bunch of things happening in the medical community. The FDA screws up because they give special benefits to certain companies under certain circumstances, and it's got to stop. So go ahead.
You recommend it, and I agree with you, Jim. But there's something that you said that I want to clarify. You said the liability, and we don't have liability for big pharma, and that's a government problem. Right. Don't you think that's a victim problem? Because you know what? The government sets the policy and they don't get held accountable. It's the ones that get hurt, injured, and dead. It's a victim problem. It's an American citizen problem. So how do we circumvent that to actually be able to have liability, be able to get compensation, to be able to get the retaliation that we deserve if they knowingly do this?
We change the laws and we take the power out of bureaucrats to provide for such things. Now, that is a problem of Congress ultimately, although it's a little bit more complicated than just that. Every bit of liability should be taken away from any medical procedure of any sort, whether it's an administered drug or a physical procedure that's approved in any way when it comes to the operation, or and DME companies and the equipment that they provide. Every bit of liability protection that is granted by the federal government, at least, should be entirely taken away. States can deal with things the way they want to deal with them, and that's what our Constitution provides. Because if you do that, then you got to be good about it. Yes.
So you know that this is not a COVID vaccine issue necessarily. You do know that vaccine manufacturers have had liability protection since 1986. And the reason they did that, Jim, to go to your point, was because people were not making vaccines. And smaller companies do have that protection as well if they wanted to make vaccines, but apparently they do not find it, maybe it's just too much money for them to spend on the research and development, et cetera. So people think this is a COVID liability issue. It is not. It relates to national vaccine.
Right.
Yeah. Right.
Tara, I want to ask you a quick question, Jim. If you don't mind, I want to ask Tara a question on that, because I think this is really important. If, let's just say, we were able to hold these pharmaceutical companies liable, and let's say the government did not give them immunity, and I'm talking about specifically COVID, do you think COVID would have been unrolled differently? And do you think there would have been Operation Warp Speed if we knew that if there was vaccine injuries, the American public can go after and actually sue Moderna, Pfizer? Do you think that would have changed the rollout?
Absolutely.
No. Okay. So let me answer.
No, I do. I absolutely do. I think that they would not have. Really? You think they would have gone forward?
Well,
it would have been much longer. Yes.
Yeah, it would have been longer. It would have gone forward. But here's the thing. See, the problem with this, I want to answer in two parts. Storm, I'm going to answer your question here in just a minute. But let me go back to what Tara was saying. And by the way, for those on the panel, even though I disagree with Tara on a lot of things, I really like Tara. Okay, I'm just telling you personally.
I like Jim too.
She knows
I like Tara too.
This is such a love fest.
Yeah. So anyway, but we argue, and we're going to argue about things that we disagree on. But anyway, but back to what Tara said. So here's the problem with the 86 law, and you set it up perfectly, Tara, in what you said. See, here's the problem. And you mentioned, and also small companies could do it too. Well, the thing is, the liability is for large companies in effect, because by virtue of being small, you don't get the broad distribution. The logic behind the 86 law is flawed, because what the law was passed because manufacture of these vaccines was on the decline. It wasn't eliminated, but it was on the decline. And there was a concern that would go away. But the logical flaw was, and therefore we've got to have vaccine manufacturers. Well, I disagree with that, because if a vaccine works and it's doing good, then it will get produced, and companies can. And it happens all the time, because there's most companies, most major companies, any company has liability, and they have to actuarially, in whatever fashion, whether that's by buying an insurance product or keeping some money on the side in their books every month, or however they do it, and a whole range of things between that you can actuarially account for your liabilities. That happens. Every major corporation has a legal department, and they do have insurance of some sort, depending on the type of business they are. That would continue, and then all of a sudden, if liability were there in some significant form, then you're only going to have the best vaccines out there. As it is, it's like a welfare program. It became like a welfare program. Just make any freaking vaccine you want. Now, to the second part of what you were talking about, Storm, we would have moved forward. Like, there would have been actually a more realistic and altruistic movement to get a vaccine out there. But what happened with this vaccine, particularly with Pfizer, is that, and to a certain degree with Moderna as well, the other mRNA vaccine, is that there was not enough research. Like, mRNA technology is still in a relative development stage. It's fairly mature by the time they started to do this manufacturing, but it still is in a relatively new phase. So they should have done, their studies were absolutely useless. They came out of the gate and said it was 90% effective, and now we know that was a freaking lie. So if the liability is there, then you don't lie as much.
Jim, if they'd have taken another 2 years or 5, do you think?
Hey, by the way,
And not that any of us know, do you think if they'd have taken another 24 months, 2 questions, do you think it would have been approved based on the things we're seeing now?
Mm-hmm.
And number 2, do you think COVID would have just handled itself and we would have had herd immunity and it would have gone away?
Yeah, we wouldn't even need it.
So I'm not a doctor.
Of course,
and
everybody
so
knows you're not a doctor.
But I look at this information really closely and have for these last 3 years. So to answer your first question, yes, it would have been approved after over 24 months, and it would have done. They would have done so. Still,
it would have still been approved as it is right now, as it is.
With the 6% mortality rate and myocarditis known.
But no. Listen, we might not have known. Listen, there are risks, okay? But anyway, so let me answer the question before anyone interrupts. I want to answer both questions and then bug me. First, the answer to the first question, it would have been approved after 24 months with an emergency use authorization. And if they had known that they had liability, then the companies would have said, well, we're not ready to do it yet. Let's take a look at a few more things. We're going to do a couple more trials before we're ready.
So it wouldn't have been approved. Then it wouldn't have been approved, Jim. Then it wouldn't have been approved.
No, absolutely.
Okay, but they wouldn't have rolled it out. They wouldn't have rolled it out.
The only reason.
But Jim,
that they would not have rolled it out.
Would it have been rolled out then, Jim?
Okay, but let me get to the second. Grant, let me answer the second question because you'll get where I'm coming from here. Anyway, no. If the companies had felt it was workable, they would have done 2 things. They would have taken an approval under an emergency use authorization, and they would have said very clearly, but you got to understand, we're in emergency here, but this could be a little risky. And then they'd have been more clear in their disclosures. The second thing,
and then they wouldn't have got 70% of the population to take it if they'd have presented that. We'd probably be at 40 or 50% of the population.
We don't know that because
you could see when they pressed. You could see when they started pressing the business owners, to say, hey, it's going to be a $14,000 fine.
People would have done it voluntarily by that time.
No. Yeah, but to get from 45%, Jim. Hang on a second. No, hang on. To get from 45%, which is where they were, that's when they started pressing. Somewhere around the 50% mark, they started pressing business owners with the OSHA bullshit. This is when I started getting noticed.
Oh, Grant, they did that not because of numbers. They did it because of the financial commitments they made to the pharmaceutical companies. That's why those were coming in there. And I guarantee you, listen, there would have been some politicians who and or businesses who did that who wouldn't have thought like this. But major corporations, major politicians put in those requirements because I'm telling you precisely, I've seen it in Washington, D.C. and other areas. They did it because of the financial commitments they made to Pfizer. They didn't do it because of the numbers. But the second thing is this, after 24 months, and this goes back to the whole herd immunity issue. You don't need a vaccine for herd immunity. It's helpful, and it can bring about some aspects of it that would be useful to get to herd immunity. Herd immunity comes through natural infection primarily. That's vaccine science forever. It's not getting everyone vaccinated. When it came to polio or smallpox, you vaccinated some people while others were getting it, and then that vaccination started to build.
Yeah, but Jim, they're still pressing. Jim, they're still pressing. They're still pressing. They're still spending money on ads. They still want to get kids vaccinated. Yeah, all that's good what you're saying, but they're still pressing. They still want the rest of the world.
But that's because of the government incentives and because of our willingness in our federal government to allow the federal government to dictate what people ought to think and do. And they have the power to do it because of where we stand. And which gets into a broader issue of what I say. If we went back to constitutional government in this country, we would have an economic explosion that could never be paralleled again in world history because the government holds things back. They give special benefits and measures to large corporations that are their patrons, and that brings a mix into the public debate and other things that is caustic to real science and reality. The only purpose of government is to make sure that when people are harmed, that they have a recourse under the law to deal with it. It's not the job of the government to make sure the culture or society does certain things. That's not government's role at all.
Hey,
I'm very libertarian.
Jim, Grant, can I just say something? This is Mary. The one question that I've never heard anybody ask is, I just looked this up. The mRNA, technology was developed back in it was developed in the late 60s, but started to be used in the 70s. I have a whole bunch of questions around this. Number one, first of all, we have this company that started in 2010 called Moderna that had never, ever, ever once come out with a single product. The name of this whole room is, did the USA government conspire with pharma, media, and big tech? How could you not think that that was the case? So why in the world, if these guys were looking at this technology all the way from the 70s, and all of a sudden we've got 2020, how many years later, that nobody has tested it for a length of time. Nobody has tested. So it comes out 9 months later. I'm sorry. It's insane to say that, oh my God, they just developed it. Isn't that amazing? How lucky are we? And oh my God, the media is all talking about it all at the same time. Isn't that amazing? And oh my God, now we're telling everybody they have to take it. Isn't that amazing? Like, come on. Like, you're naive if anybody ever thinks that didn't all happen as a very well orchestrated plan that rolled out completely in an organized fashion.
Can I say something?
I would actually like to finish if you don't mind.
Oh, yeah,
So my thought process.
Damn. Okay. Let's go, Mary.
I get tired of guys like just always cutting people off. So my big question around this is, we did not study, I remember talking to Dr. Catherine in our clubhouse room saying, when she's like, it's perfectly healthy for pregnant women. And I'm like, that is so inappropriate for you to say that, Dr. Catherine, because what you should be saying is that there have been no studies on pregnant women. There have been no studies around this. You don't tell pregnant women that it's safe. It's safe as far as we know, because that is not what is it?
Informed consent.
Thank you. I know. It was my vodka today. Informed consent. That's not. It's like you're lying to people by not sharing. That is lying to them if you don't share the truth. Why did we not have any? Why were all of these companies, Pfizer, Moderna, et cetera, how did we not have these studies in advance? How is it that they've been studying this technology for all of these years, 30 years, and we don't have anything that says how long it might last, whether there's any potential side effects, whether the spike protein stays in our body longer, whether it's healthy for pregnant women, whether there is, I don't know, a man having sex with his wife he's vaccinated and she's not, and it shows up in the breast milk of for her baby that's now getting the spike protein. This is literally, I heard it said, this is the worst thing that has happened in humanity.
Mary, how could it be studied?
Can I please finish? Sure. Can I please finish?
Yeah, Tara, please stop.
Can I please finish? This is the worst thing that has ever happened. And I truly believe that after listening to all the doctors, and finally, again, thank God for Elon Musk. Thank God for all of these doctors that now have a voice on here, because we've been talking about this for a long time. And I'm sorry, you guys have had this vaccination. They had this for a long time. And now all of a sudden, guess what? It only lasts for 6 months. Why do we know that? Because they only tested it for 6 months. Oh, it's perfectly safe. No, it's not. Like even the study that came out about pregnant women, I remember very specifically a year and a half ago talking about that they completely blew up the study. They manipulated the study. And one of the key doctors that was in one of the rooms with Mario a couple nights ago specifically said that they used the wrong data. They used the data across the women that were in first trimester all the way to third trimester. They eliminated the first trimester data, which if you can run numbers, you can see that that's exactly what happened. It's what I talked about over a year ago when Dr. Catherine said it's perfectly healthy for pregnant women to take this. And it's like they literally 82% of those women that took it in the first trimester, they had miscarriages. So, and that comes from a doctor that is the foremost doctor as a OBGYN. And we have been lied to, and the doctors have lied to us with their sweet voices. And they're like, oh, it's all fine. And I'm sorry, I'm not going to have a sweet voice because I'm pissed. You know what? And how many people have our doctors that said it's perfectly healthy, just keep taking it? How many people have everybody killed? And Tara, I'm going to say the same thing to you. It's inappropriate maybe for me to say this. You keep saying that it's safe and healthy. I don't know how you live with yourself. I just don't, because it's not. And we all know that. All the data's coming out, and you know the data's coming out. Like, it doesn't take a lawyer to read the data, and it doesn't take a data scientist to read the data. It just takes a person to just take the time to stop reading the fucking headlines and read through it and actually go to the data. Like 96% of doctors are vaccinated. No, they're not. That was, the AMA came out and said that. Guess what? It was published everywhere. 303 doctors were in that survey. There's over, 500,000 doctors in the United States of America? 96% bullshit. You know what? They have been screwing with us from the very beginning, and a lot of people have died because of it. So
could I respond since you spoke to me? Could I respond? Can I respond since Mary spoke to me?
Let's go.
Take it away. What she said, what she said was so good, Tara, that
I don't think so. First, no, I don't acknowledge it, because first of all, I do not think the 82% figure is right, but I think you're wrong about that, but I will put that.
Totally is right.
No, it's not right. Okay, number two. Wait,
you're going to
Dr.
overtake a 42-year OBGYN. Okay, but that's fine.
Can you just let me speak? I thought you asked for grace to speak, but now you don't.
You're right.
Okay.
No, you're sorry. I apologize.
Okay, no problem. Okay. Secondly, one of the things you were saying is, how could we not know these things? Well, they were studying mRNA for different usage and cancer treatments, liver treatments, etc. They weren't studying this vaccine. So, of course, until this vaccine was developed, they could not have known these things. So I think you're just conflating the time frame as if they were studying the mRNA COVID vaccine, but of course they weren't doing that until they started developing it. Do you understand what I'm saying? And number three, I want to go back to one thing, because I actually went back and looked at this. Grant, remember we had this discussion about whether people have been saying, the reason why they did this under EUA and they couldn't have a treatment was because you couldn't have the vaccine and the treatment. Do you know what the first EUAs were given for COVID? They were given for monoclonal antibodies before vaccines. So yes, they can have both. In fact, they have had both the entire time. The existence of a vaccine under an EUA does not mean you cannot have a treatment under an EUA. So all these people who are saying, they did this because, are making that up. Sorry. Thank you.
No, I just want to respond to that. Tira, ivermectin and hydroxychloroquine were both entirely banned. We were told that by using it, it's like you're using a horse paste. It could kill you. It could harm you. The poison control centers are saying that they're off the charts of people being poisoned by ivermectin. So
but
that
I'm not
is completely
speaking to
false.
That. No, I'm not speaking to that, Mary. I'm speaking to the fact that people said that basically the EUAs, you could not give an EUA for a treatment because the vaccines took the place of the EUAs for treatments. That is not correct. Okay. No, you might understand that, but Grant doesn't.
You know what I think, Nelson? Excuse me, Tara. You know what I think, Nelson? We should
take
this conversation to your room.
That's what I'm thinking myself.
But before we do that, heated, man. Jim, this is what you started. Okay, this is what you started, Jim, with your bullshit, talking about the vaccine being a miracle saver. All kinds.
Hey, here's the deal. Your numbers are up, dude. Your numbers are up since I got in the room.
Facts.
I think this
vaccine
is going to go down. It's going to go down in history as the biggest human travesty ever created in civilization's history.
And what are we going to do about it, Grant? What are we going to do about it?
100%.
I just come in here and just keep giving my unprofessional viewpoint until I'm right or wrong.
And I got a question for Mary, right? Before we do this thing real quick. Mary, you here?
Of course, yeah.
Mary, so, my wife took my kids to their doctor, I think that you call them pediatrician, about a month ago. And the doctor was trying to advise my wife that it would be smart to vaccinate my 2-year-old and my 1-year-old for COVID, right? What are your thoughts? Matter of fact, I don't want you to give me a long answer. Just give me a short 10-second answer. What are your thoughts about kids getting vaccinated?
That person should lose their license. That's what I think. That doctor should lose their license. There's a 5,000 children. First of all, 5,000.
But instead they'll be rewarded.
Yeah, exactly. 5,000
That's
children.
That's a fact. Wait, Mary, 10-second answer. 10 second answer.
Okay, that's it. No, I just want to make a point.
So,
I want to say this. No, 5,000 people under the age of 19. And then 19,000 under the age of 29. So that's what it was. Out of 1 million people that died of COVID during the Delta, guys, during the most serious, part of the COVID time that we had, that's all that died. And they didn't die necessarily from COVID. They died with COVID. And they didn't talk about any pre-existing, comorbidities or anything else. That's how many, 5,000 children out of 1 million. That's 0.00004%. I've said it a million times.
Absolutely.
So,
absolutely.
And now Omicron is a cold. So yeah, that would be insane.
Mary, that's like 210
I'm
seconds.
I'm done.
So the reason why I asked that question, number one, this is probably.
But Mary, it's only 0.005, just so you know, just to get your math right, because Tira's going to call you out on it. There's only
100%. And so, what I found out was a lot of pediatricians are actually recommending the COVID vaccine for kids. So here's what we did, right? We set up a space. The link's up top, by the way. Everybody in the room, hit that link up top right now. We're about to open that space up in about 60 seconds.
The link's in the Twitter nest.
The link's on a billboard. I'm calling it the billboard. Twitter nest is lame. How do you even
find which one it is, though? Oh, I see.
It's the most recent one, right? So we brought that conversation to the forefront. We invited a bunch of doctors, pro-vax, anti-vax, people who believe in vaccinating kids, and people who don't believe in it. We're going to have a massive debate right now. So everyone in this room, we're transitioning to the link.
Dude, you took that from my invitation against.
Man, somebody mute that guy. Grant, what do you say?
Is your guy Copeland going to come?
Man, I don't think so, man. So, ladies and gentlemen, I'm about to start that room right now. Links up top. Let's transition. GC, let's talk about it.
Thank you guys for being here tonight. Appreciate your input, though.